Okay, all set. Thank you.
Great. Thank you so much, Barb. I'd like to call the meeting to order. I wanted to confirm that there is no registers, public speakers, Barb, is that correct?
That's correct. Thank you.
Thank you. So we're going to kick off our meeting tonight. Thank you, everyone. Looks like we have a lot of guests here with us. Thank you so much, everyone, for joining us. We're starting our meeting with a very, very important topic for all of us all over the world, and contextualizing here to Madison, how this conversation around I'm sorry, I'm just lost here where I'm at. What is our first topic? It's reopening, right?
Correct.
Correct. Okay. So the conversation around open or not open the school, and it's the simplistic nature of that conversation seems like such an easy thing. All we have to do is turn the lights on of a building and invite our students in. I, of course, have looked into a lot of the data, like many people, listened to a lot of health officials around this issue, been watching the news like many people, and had an opportunity also to read many emails that we as board members have been receiving on their plea either to keep the schools closed or please to open the schools. And none of those decisions are easy decisions, and I'm really grateful for Dr. Jenkins and his team to be looking outside of the districts for resources and for information and making sure that we are following the science. Of course, myself and I'm sure many of my colleagues share this opinion with me that we wish we were not in this situation. We wish that those are not the decisions that we're making. Definitely, when I ran for office last year, I would never imagine that this is the conversations that we would be having a year and a half later. Unfortunately, we are in a situation that we are. We had definitely an administration that didn't take care of its people, and we are in this constant confusion about the path forward for us. What we're not confused about is the death toll of COVID, the impact on our families, the impact on many children across our city, and in particular, in the impact on individuals that are most marginalized. So many of our students of color, the impact of COVID has disproportionately impacted them. So many of our families, so many of our students with different levels of abilities have been impacted by COVID. This COVID has increased the disenfranchisement and the marginalization of people that were already in a pretty dire situation. So I wanted to share with all of you that learning more about what our district has been doing, and also in particular Dr. Jenkins and his team, the sharpness on understanding what's happening, the constant seeking out health officials' perspectives on how we're doing this, and also spending numerous hours on doing his own research, and the teams doing their own research on how to do this transition safely when the time comes, as well as responding to every email, whether it was an email of support for the schools to not open, whether is the email is to contest our decision to remain closed. And I think that speaks a lot to Dr. Jenkins' leadership. It speaks a lot to our ability to lead a district where we are prioritizing our students' lives and our staff lives. I think that's what we're talking about. The other item that I wanted to bring up is that for both staff and families and students across our district, we have a channel where people can share their opinions or let us know what's happening. And I know that in this time where there's so much misinformation out there, this is extremely important. So please do reach out to us. We have a channel that's called Let's Talk. There is also a board email that folks can also email us on this. With that, I wanted to pass on to Dr. Jenkins that was going to talk a little bit more about the district's decision, where we are, bring some of our guests to the space, and then also talk about the many efforts that we have been doing to making sure that we share with our families when we're talking about metrics, what we're talking about. I know many folks are comparing our districts to other districts. We are board members of Madison School District. We're not board members of any other district other than Madison. And we are responsible for Madison. And Madison has a lot of things in common with other districts, but many, many, many different unique experiences, both from a demographic perspective, from the amount of numbers of students and families that we serve, the challenges with our buildings, many challenges that are very particular to Madison. So I wanted to start our meeting tonight by sharing that, and then also asking my colleagues that if you have questions, please write them down, and then we'll just do a round robin as we have done in the past. With that, Dr. Jenkins, I would like to ask you to come and speak with us. Thank you.
Thank you so much, Ananda. Can you guys hear me? Am I breaking up at all? I'm not? Okay. First of all, thank you for how eloquently you shared the key up for this particular presentation. And I want to just say thank you to all of the board members for your support, but thank you to our community. What a community. We received tons of emails in support of reopening schools and in support of remaining virtual. I think Madison is a model for the nation of how civil the individuals were in their communication with myself and to the board. I've had countless conversations with individuals in our community, with students as well. And we tried to really reach out to our entire community. Actually had some Zoom conversations with different parts of our community on the south side, southeast side, north side, had some social distancing meetings, trying to get the voices of our community, just countless hours of trying to hear everyone. And I tell you, this wasn't an easy decision. In my 30 plus years in education, I tell everyone, this was like, wow. I don't care how experienced you are or you felt like you were, you really, any decision that we made about this had 5 other things attached to it, and that had 5 other things attached to it. So I appreciate the patience and the civility in which we have approached this. And our partners, Mr. Statz is going to introduce them in just a moment. We have a staff that's caring, and we realize that this is a global health pandemic first, with dire consequences if we're not paying attention to what we need to pay attention to. And at the federal level, there were some challenges and remains not intentionally. There are some things that in the medical field you hear, there's still some conflicting information even as of today. Okay, so CDC trying to understand where they were coming from, trying to understand where public health is coming from, trying to work with my colleagues here locally, also nationally, but we had to ultimately do what was going to be in the best interest of the safety for our students, for our staff, for our families, and for our community. And that within itself has been tough, but I tell you, it was something that was necessary we had to do. So Having said that, we use a set of metrics to guide us as one decision point. And we had an internal and an external advisory committee. And tonight, Mr. Andrew Statz, our researcher here from our research department, I'm going to have him just introduce our guests and he'll walk you through the process. But I can't thank everybody enough for your patience in lifting up certain things that perhaps just brought another lens to the table. And we're doing everything that we can. Also, that to address the socio-emotional piece. And our staff as a whole just been working very hard because we knew staying open, it would be some issues. If we close, there would be some issues. And we heard you. I want you to know that we heard you and we're working together to try to make sure it's the best possible, the safest thing and the best possible learning experience for our children. So at this point, Mr. Statz, could you go over our process for everyone and introduce everyone else?
Yeah, absolutely. Thank you, Dr. Jenkins. Thanks to the board for the opportunity, and thanks to our guests who are joining us this evening. So we thought we'd spend some time introducing our guests that join us regularly from the UW Health and medicine community. Walk through then the metrics that we do have posted to the web to make sure that we're grounded in what those metrics are, and then pause to see if the board members have any questions for our guests before we allow them to go about the rest of their evening, and then talk very briefly about our survey results. And then the last piece of business for this agenda item then is a review of 3 policies that must be in place according to public health requirements before we reopen. So I'll start by saying that every Tuesday we get a group of central office administrators, a handful of principals, MTI representation, as well as UW School of Education and School of Health members joining us. And the topic is to go over the metrics that we use to monitor when is the time to reopen our schools. So joining us this evening was Ellen Wald. She did have to step off for another engagement. She is chair of the Department of Pediatrics at the UW School of Medicine and Public Health. She also holds certifications in pediatric infectious diseases. She has been providing us support to this date, and we can count on her also into the future. Joining us also then is Greg DeMurray. Dr. DeMurray is a professor of infectious diseases and a researcher at the UW Department of Pediatrics, specializing in respiratory infections. Also, Dr. DeMurray is a longstanding consult for the district on health issues. And then joining us is Dr. Tom Friedrich. He is a professor at the UW's Department of Pathobiological Sciences with specialization in virology and pandemics and influenza. So here we are with the right folks from the UW School of Med. And I'll also then invite Malia Jones to come on screen here. And she is an assistant scientist then at the UW's Applied Population Lab. We have familiarity with the Pop Lab. We're big fans and frequent users, so happy to have her joining us. And she has specializations then in vaccinations and public health recommendations and epidemiology and health as it relates to neighborhoods. So I ask each of our guests here to just share your engagement, your experience with the district around the reopening process and the metrics we've used, and any highlights you'd like to offer before we walk through our metrics. And Dr. DeMurray, could we ask you to start first, please?
Sure. First of all, thank you for having me, and it's been a pleasure working with Andrew and his group, and I want to especially say a thank you to Sally in the health office as well. As Andrew said, I've been a consultant for the school district for the past over 20 years. And this is probably the most, and definitely the most challenging issue we have faced. There's not easy answers when it comes to COVID, but I do want to say we are gaining a lot of data, a lot of experience. And some of that's in the trenches, real world experience, and a lot of it is gleaned from other institutions and other pediatric organizations. My professional organization, the Pediatric Infectious Disease Society, is very active in this area. So pleased to answer questions as they come up.
Thank you, Dr. DeMurray. And Dr. Friedrich, if you'd like to say a few words.
Sure, I'm Tom Friedrich. I'm a professor of virology in the School of Veterinary Medicine, but I study emerging pandemic viruses with the emphasis on flu and then Zika and now SARS-CoV-2. So together with a bunch of colleagues in the medical school, I've been working to get testing for the novel coronavirus available to K through 12 schools in Dane County and thinking through ways that we can use testing to reduce the risk of virus transmission in schools. I'm also involved in a lot of projects that are looking at the genetic epidemiology of the virus. So we're tracking how the virus spreads through space and time and how new variants of the virus might affect our calculations. So you may have heard of these new strains of the virus that were detected in the UK and South Africa and Brazil and other places now. And so we're really trying very hard at UW-Madison to keep an eye on the circulation of these viruses in Dane County and try to understand how that might affect our calculations for reopening schools, among all sorts of other things.
Thank you, Dr. Friedrich. And it appears Ms. Jones may have dropped off our call. I'll pause to make sure that that's true.
She will be back on in a second.
Terrific.
I'm back. Apologies.
You are. All right. Thank you. I'll ask that you turn your camera on and offer a few words about your engagement with the MMSD reopening process and see if there's any highlights here or updates you'd like to provide.
Certainly. I am sorry I missed the other introductions so I could match them, but thanks for bearing with me. I am an social infectious disease epidemiologist at UW-Madison, and in non-pandemic times, I study spatial effects in vaccine hesitancy and herd immunity. And since the pandemic started, I have been involved in some public-facing communications around pandemic safety issues locally and nationally. And I haven't actually been directly involved with MMSD's reopening decisions, but I'm happy to be here to comment on and take any questions about the pandemic generally and the most recent news about school reopening safety.
Yes, Andrew, and if I may, in fairness to Ms. Jones, she did a podcast that was one of the hottest podcasts out there about this whole science behind schools. And I received it from several individuals, so I just called her up and asked her if she would come and share her thoughts and answer questions for us tonight. And also we have our family parent engagement because she humanized it at the level where everyone could pretty much understand it. And so I thank you, Ms. Jones, for showing up as you said you would.
Yeah, thank you, Dr. Jenkins. The popularity of a podcast, you can understand the interest these days. And also it does underscore the not only the interest that we have in this topic, but then also not only we have the best local experts on it, but the best national and international experts on the topic. So Melissa or Barb, could we go to a screen share and then we can briefly walk through the reopening slides PowerPoint, or you can provide me with share rights and I'll drive myself, your choice.
I can certainly do it for you here. It's Melissa. Hang on one second.
Thank you, Melissa. So as Melissa's queuing this up, we did post all of these metrics to our public website, and that has been posted then about midday Friday. We do look at these regularly. I look at them daily. We will be providing updates to these based on the public health updates to their weekly snapshots. Generally, they are published Thursday evening. So Friday mornings, we would be providing updates to these metrics. A lot of the metrics are not driven by public health updates, but it seems good to package them that way. So these would be weekly updates. So the next slide, please. So when we look to reopen our schools, we do have to consider a whole host of metrics, and many of them are informed by public health, but then also some of our own operational considerations. So we track readiness based on 3 red, yellow, green colors, trying to keep this simple for ourselves and for others. The next slide simply demonstrates the red, yellow, green, and then the first body of metrics then on the next slide shows that we break our metrics out into 3 categories. So what we'll do right now is go through public health requirements, public health recommendations, and the metrics associated with both of those, before we then pause to see what questions board members may have for our experts who are joining us this evening. We then have 2 rather internal metrics, sets of metrics rather, around family and students' intentions about returning to schools when they reopen, as well as staff availability when it is time to reopen. The next slide, please. So the requirements from Public Health Madison-Dane County, there's a handful that you must have. They have authority to require any district reopening a school to have these things in place. The balance of what Public Health recently provided in the middle of December as an update are recommendations. These are things that they recommend having in place. They may have very strong guidance around it. They may have pointers to other resources, but we have incorporated both the requirements and recommendations from public health into these metrics. And the next slide, please. So the first 3 of these is the tail end of this agenda item today, to get the conversation started around hygiene, cleaning, and protective measures policies. We have our procedures in place, we have equipment together, we have materials, so the board does need to adopt a policy to satisfy the public health requirement. Each school then has to have an action plan, which is a script of what to do when there is an event at a school that's provided by public health. We then also have to acknowledge staff receipt of these training efforts and posting the policies and workplace requirements publicly. So all of these are yellow, not because they're off track, but because they're in progress and not done if we were to reopen a school today, for example. But each of these is on track to completion, and the board, in fact, kicks off 3 of these today. The next slide, please. Next up then are the recommendations. Again, public health is recommending we follow these, and we follow those recommendations very, very rigorously. So they do recommend a phased approach. Green, we're looking at taking some of our earlier grades in sooner. Looking at moving in and out of all virtual instruction as the need arises. Do you have a means of doing that? We have experience in this regard. So again, these are green. The 5% positive tests is actually a reference from public health to CDC. We look at that number and I believe it's currently about 5.8. So it is yellow, green or less, 5 or less would be green. The percent of new cases that's showing a downward trend, we just had an uptick following the Christmas weekend. We did see an uptick in positive cases. So this one reversed a downward trend that was looking good. So this is another one for us to look at. Again, yellow being cautionary, not necessarily a red cell. And then school-based testing strategies. So we do have folks on the call today who are also helping us pilot through rapid testing at our schools that'll help us identify students who are symptomatic and asymptomatic in those environments. And the next slide, please. We, again, are looking at phasing. So recognizing the phasing nature, 4K to grade 2 generally follows the public health guidelines. We would like to see these numbers 78 or fewer for those grades to start. They're currently 168 in Dane County, and those are 168 new cases per day on average. Now, I'll point out that public health had originally published a series of cut scores that started at 54. Public health no longer publishes those, citing various factors such as the likelihood of spread among younger students, younger children seems lessened. Their likelihood of severe complications is also less, comparatively less. But also really proof that many of the strategies that we just talked about in those policies as it relates to cleaning and hygiene and protective measures are proving to be effective. So these are higher than we would like to see them. We do have experts on the call that could answer questions, more questions around these. But it's important to remember that there's no magic number as it relates to these cases. 78 is informed by CDC, and that simply crosswalks the CDC thresholds into the Dane County environment. So these, again, are intended to convey relative risk for the community, but no single number. So these are ones we monitor quite regularly because of that. And then the next slide, please. Further recommendations then, social distancing. We certainly want to make the best of that mitigation strategy. It is yellow because once we have a better idea of which students are coming back, then we get exact floor plans. But we've made a lot of progress already on communicating expectations, planning around avoiding the mixing of groups and so on. Face covering and hand washing, both of those are green, indicating that we have sufficient trainings available, sufficient equipment in place, and so on. And then the next slide, please. Each of these then breaks out some of those similar strategies in those policies, but we wanted to make sure that folks could clearly see that we're going to engage in frequent cleaning, that we're going to engage in increased air handling, and that we're providing contact tracing. With a home-based symptom screener, this is yellow because it's currently in pilot mode in a scaled version. We've had a symptom screener in place for some time. What we're looking to do is convert that into a more robust environment, one that can work for all students when the time comes. So this is yellow because it's underway. And then the next slide, please. So with that, we'll come off a screen share and see what sort of questions the board may have around these public health and CDC related metrics, and see if our experts need to provide any of their expertise, I suppose.
Thank you so much, Andrew. Can I see hands or? Okay, so Nikki, Schmidt, and Caruzzi.
My question just is, I think these are, I would wish it was down more. I'd love to be back. I know it's not safe. My one thing is, how do we make sure our schools are ready? I remember when I was touring, the sinks in the West locker room were not completely functional. At Leopold and Cherokee, not all the sinks worked. How do we make sure that our sinks are actually working? I mean, we could have a hygiene policy, but how do we know if they're actually doing what they're supposed to be doing? And no offense to our maintenance department, it's just we have a huge district.
Yeah, thank you, Nikki. I will say that every school has a multi-page walkthrough checklist necessary to make sure all of those boxes are checked. Things very similar to how we actually open a school district under normal circumstances, but this time adding in that additional lens of the circumstances. So yeah, there is a walkthrough tool that would address things like that.
Andrew,
So
and to all the board members, if I could just have us focus on those questions where we could use our experts. They may have to leave here in just a moment. I want to make sure you get all of your questions from our experts first, and then we could be here to answer the rest of them.
Great, thank you, Dr. Jenkins.
Thank you, Dr. Yeah, Christina, is your question to our experts?
It is, and it deals with the public health Madison-Dane County metrics and how they overlay with the CDC metrics. And in looking at those CDC metrics, you talked about there's this range that CDC is giving to show the relative risk depending on the ranges. And that Madison-Dane County went away from using a single number, but on the slide where we have the recommendations, we're showing a single number. So my question is why are we using that instead of giving a range, maybe? Because it does look like it's a threshold again. And then my question is for the pre-K to 2, it has us at 168. I've been watching that 14-day average really closely throughout the whole fall to watch. And it looks like we want that on a downward trend at this point, but aren't necessarily looking for a threshold. So I guess I'd like some more information about how the thresholds interplay with the recommendations on reopening.
Yeah, I will offer one observation and then ask our panelists to join in. The recommendations from public health still are that districts have some consideration of the presence of COVID-19 in their communities as a consideration. So we're following a recommendation from public health that we still consider case counts. They also recommend that districts have a threshold by which they consider that level of risk, the relative level of risk, and then they refer us to CDC to inform those guidelines. So following that series of recommendations is how we ended up here. I would say as far as a range goes, within those, with a kind of recognizing, again, how we operationalize these is not necessarily a specific cut point, but if we're going with a red, yellow, green, it does imply kind of a range. So I would say, for example, if we're looking at middle school, it's a range that's about 63 then to 78. That could be yellow for your middle schools. So we are looking at a range, so to speak, though it may not be communicated this way. And I'll pause for others to add that.
Any of our experts have anything else to add to?
Sure, there's a degree of arbitrariness to those magic 3 numbers we've all been following. And I think we have to appreciate that. Yes, they're developed by CDC and other organizations, but I think they have to be taken with some degree of caution and interpreted with the degree of caution when looking at the entire picture and what is going on in the county and in the country.
I guess I would just add there that the numbers as they get kind of translated into metrics for Dane County look very precise. So that they may look like, 78 is a very specific number. It's not a round number, and it may make it seem like there's a whole lot of thought behind that number, but really that's just taking a round number from CDC that was used as kind of an estimated cutoff for what might be considered high, medium, and low levels of transmission from the beginning of the pandemic, before there was sustained high levels of transmission that we have now. And then just multiplying those kind of round numbers, like 50 cases per 100,000, 100 cases per 100,000, times 540,000 people in Dane County. And so we get these precise seeming numbers, but the basis of those numbers is still like really just kind of guesstimates of what we might consider high, medium, and low levels of transmission that, again, could have been used, were suggested as guidelines to like, well, so is transmission in a community high? Is it not so high? Is it low? And that's really what those numbers are there for. There is no evidence, and Malia and Greg maybe could correct me, but there's no evidence that I'm aware of that school-based infection or transmission is like significantly more likely when you have 51 cases per 100,000 in your community than when you have 49 cases per 100,000 in your community. So these are just sort of like benchmarks, and they're not magic in any way, like we've been saying.
Yeah, I would agree that with that point that they are really ballpark figures. And I think Christina also raised an important issue, which is not included in these recommendations, is that I would want to see the rates trending down. In fact, I think the trend is much more important in some ways than the specific number of 78 cases over the 14-day average does incorporate that trend, but I'd like to see the rolling average moving in a down or stable direction.
Yeah, and we do have a downward trend, as Ms. Jones points out, in the number itself. For something to turn truly green, we would want to see it maintained at a certain level for 4 weeks, but we also then have the regular weekly comparison to previous caseloads. So we would want to see that on a downward trajectory, and the way that we've crafted that is a downward trajectory for 4 weeks, because we agree that we do want to see it headed in that direction and don't want one good week to make us lose sight of the context that our schools will operate in.
Right. Thank you. And I think, you know, just in having listened to some of these conversations, it's not just necessarily about the number, but it's about the mitigation strategies that we're taking to reduce the risk in our schools. And so I've really appreciated learning about that. And Dr. Friedrich, I guess I would ask you, could you explain a little bit more to us about the testing? And our potential ability to provide rapid tests to students, and how that might work.
Sure. So my lab, together with colleagues here at UW-Madison, has been working since the spring on ways of doing, you know, better rapid testing so that we could get testing available to greater members of the community, and that sort of developed into a real focus on testing in schools to make schools safer. So let me see, in November, we communicated with some folks at CDC, and we're able to get a batch of these rapid tests. So you've heard of the antigen tests, the tests that are done in 15 minutes. So the federal government bought up all of the tests that were made by this company called Abbott. These Binax Now tests that are read in 15 minutes. It doesn't require any lab. And we thought this was sort of the perfect format to be used, sort of widely distributed to schools. You know, it's something that's very simple. A school nurse could do it. You know, my 7-year-old could maybe do it. And, you know, we were able to get 5,000 of these tests for schools in Dane County. And so we've been working with schools throughout Dane County to get at least one kit of tests out to schools. The recommendation for these tests is that they should be used to test people who have symptoms, because the data that we have on the performance of these tests shows that they're very good at detecting the coronavirus when people have symptoms within the first week of symptom onset. But they're not as good at detecting infection in people who don't have symptoms. There's actually, CDC just published another study that was done at UW-Madison of students there, and showed that it wasn't very good at testing people who didn't have symptoms. So that's an important distinction. The CDC wanted to kind of surge this testing capacity towards the end of 2020, which is why we were able to get these tests. But with the transition of administrations and changing priorities, it's just sort of not clear whether more tests will become available, and if so, where they would come from. So my colleagues at UW and I are actively working to try to figure out, you know, who in the federal bureaucracy is going to be able to help with this. In fact, Dr. Wald and maybe Dr. Demiri, I don't know if you're part of this too, and some School of Public Medicine and Public Health colleagues and I have a meeting with representatives from the Wisconsin congressional offices later this week, where we want to follow up and try to figure out how we can maybe get more tests available for schools in Dane County and in Wisconsin. You know, I think we're able to do this kind of quickly because we have, you know, close relationships between UW-Madison and the Department of Health Services and Public Health Madison Dane County, and I mean all the relevant stakeholders. And so I hope that we can, you know, make this more sustainably available. But unfortunately, with the supplies the way they are, we just don't know what's going to happen after this initial shipment is done.
All right, thank you
so much.
And I just want to say thank you for all the work you're doing and for your advising and continuous discussion with the district as we're making these important decisions.
Thank you. Chris and Ali.
Thanks, Ananda. I want to thank the UW experts who are with us tonight. I hugely appreciate your taking time out of your day to come talk with us. This is incredibly valuable and useful. I wanted to follow up on Chris's questions about testing. So I know that UW-Madison is moving towards twice weekly testing for everybody on campus. I know that a lot of the colleges that had very low COVID rates this fall were testing everybody on campus 3 times a week. Colleges are congregate living facilities, so they're a little bit different. But I feel like testing is going to be a part of keeping schools safe. And I'm wondering, like, 5,000 tests in Dane County is nothing compared to our student body and our staff in MMSD. It's a teeny drop in the bucket. Given that vaccines for youth probably won't be available for a while or even approved for a while, what kind of a testing regimen would you think about for K-12 schools that might actually be effective in terms of protecting everybody? What should we be thinking about funding or trying to advocate for as we move forward to keep everybody safe?
That's a very important and very big question. So I'll say a little from my perspective, and then I'll let the others weigh in too. This is something that we have thought a lot about in the last 6 months. And I think my answer is a little bit different now than it would have been 3 or 4 months ago. So definitely there's been a lot of advocacy for multiple tests per week. And the reason why that's important is because we've just seen more information from CDC suggesting that maybe half or maybe even more of transmission comes from people before they develop symptoms. So you can be infectious to other people 1 or 2 days maybe before you start to develop symptoms. And that's, of course, the most dangerous time because you don't know to take precautions to stop the spread to other people yet. And so the thinking is that you can catch those people who are kind of on their way up in terms of the amount of virus in their system if you test everybody very frequently. And so like sooner or later, someone's going to turn positive and then you can isolate them quickly. That's the thinking. It's extremely expensive to do that kind of testing. It's extremely expensive. I can't remember off the top of my head how much it's costing UW. Maybe Greg knows, but it's a huge amount of money and resources for tests that are going to be mostly negative. And we also have evidence from, you need to look no further than the UW football team, where they had daily antigen testing in the fall, and that could not stop an outbreak at the football team, because and even though people were being very careful. Football is different than instruction, but I do think that we have to be careful about what they call risk disinhibition around testing. So even if you have testing, it may make you feel safe, and then it may make you back off other behaviors that you need to follow to make sure that you're not transmitting. I don't think this is an argument against testing. I think it's just important to recognize that testing, no testing regimen can make a situation perfectly safe and prevent an outbreak, especially if people let down their guard for other things. I think in an ideal world, we would absolutely have, twice weekly testing for everybody coming to school. I think that would be great. But at $20 to $30 a test, let's say if you're lucky, you can just multiply that by 2 tests a week times all the students and all the staff and all the teachers. And it's a tremendously expensive program. So those are the sort of things we need to balance as we think about that.
Yeah, if I could add on to that, I would just say that testing large groups of people, such as a student body, is logistically very, very difficult. And like Tom said, in an ideal world, it would be great. I consider testing kind of the icing on the cake in terms of prevention strategies for congregate settings like schools. And in fact, American Academy of Pediatrics and CDC don't recommend large-scale testing programs currently, although that might change. I would say if a decision is going to be made to open or keep schools closed, it should be really made independent of whether or not testing is available. If we can do it, great. But it is, again, very cumbersome and expensive. We are doing a little pilot, as Tom referred, in MSCR look at this issue and see if it's effective. But I would like to say one aspect of testing probably is important, and that's making testing widely available for symptomatic individuals. Because if we can identify those individuals early, we can pluck them out of the student body, pluck them out of the circulation. And right now we have Alliant Energy Center as our main testing site, a few other ones through town. But one thing that we could consider is testing symptomatic. It'd be a much smaller population rather than doing, twice-a-week screening of asymptomatic patients. And that would be something that's much more feasible and probably has more bang for the buck.
I have a little point to add there, but I know Malia wanted to say something. Okay, so what I'll add to that is what's sort of changed our thinking more towards testing of symptomatics is those things that Greg was saying. So, yeah, half of transmission may be due to people who don't have symptoms yet, but that means half of transmission is due to people who do have symptoms. And they are easier to identify and test. They cause a lower degree of burden. And I think that if we are able to get, and this was the argument that won CDC and the Surgeon General's office over, by the way, is if you're able to get this kind of rapid testing that we were talking about widely distributed into schools, that has kind of a knock-on effect of helping the community, I think. So if students can come to school and they are tested when they have symptoms, and we can tell them right away that this is COVID, you should take the appropriate precautions, then that also impacts that person's household. And so that may be able to, so you may be able to take some precautions to isolate infected people. You could get other people tested and know that you should do that and prioritize it. It gets some form of testing available to households who may have a hard time getting to Alliant, and by giving you information in 15 minutes, it allows you to take steps that day to limit the potential spread of the virus within your household. Whereas if you go to Alliant, you might wait 3 days or something like that. And by that time, it's too late. Maybe everybody in the household gets sick. So we actually have personal experience with this where some folks we know were able to prevent a potential household transmission just because they got information of one positive case in the household so fast, and then that person could isolate away from others. I know not everyone's going to have the best way to do that, but knowing is better than not knowing in that case, I would say.
So I have a quick follow-up to this, and that is I suspect we will have a very small number of students who aren't able to wear masks. Should we have a different testing requirement for students who aren't able to wear masks in our schools to keep everybody safe?
Yeah, if I can comment on that, there are very, very few reasons why a child can't wear a mask. There are very, very rare medical reasons. Most are related around things like autism and developmental disorders. So the majority, I would say 99.9% of children should be expected to wear masks. And this has been our experience in American Family Children's Hospitals. I have patients 2 years old coming in with masks on where it's not an issue. I think we could develop very specific policies for those very, very rare situations. Clearly, we probably do have some children who couldn't, but specific policies could be developed to help them get classroom education and also to protect them in the school environment, and maybe some alternative infection control techniques.
So the only thing I have to add on this testing issue, I'm late coming to this game, and I don't know a lot about the background of logistics in terms of testing in the schools, but I am a little concerned about the interplay between the fact that children may be more likely to be asymptomatic and yet be, in all cases, live in a household with people who are older than them and maybe at higher risk. And so it's just something to add, I guess, just add to the complexity of this question of testing symptomatic children. It could maybe even be expected to be less effective at preventing transmission going back home than it might be in symptomatic college students, for example, who would be more likely to become symptomatic when they're infected. And then I actually had a question for Greg and Thomas. Has there been talk about pooled testing or some kind of aggregate strategy for reducing the costs and the burden?
Yeah, we've talked. So for everybody, the pooled testing is taking a bunch of samples from different patients or students in a situation, mixing them together, and then so doing like 10 at a time just to reduce the cost and burden. The issue, and Tom can speak to it better than I can, is that you reduce the sensitivity of the test when you do that, as Dr. Jones knows. So we've tried to shy away from that, especially with the rapid test, but Tom can speak to it as well.
Yeah, to be honest, I think pooling is kind of a non-starter. Like it actually introduces a lot of complexity to make the pools in the first place. So you don't really save a whole lot in my view. And as somebody who works in the lab, I wouldn't want to do it.
Well, and I asked if it had been discussed, but I think in a context where there's a lot of COVID-19 going around, it would actually just make things a lot more complicated, because you'd have to follow up on all of the pools, right? Or some big fraction of them. So it would be a lot of trouble for not much good.
Nikki.
So I know, Nikki, you had, I'm sure I was looking at you. I know you have some comments, but we have a few people to ask questions. So if you don't mind just being direct and succinct, I appreciate.
I will be direct and succinct, I promise. My question is this: as somebody who's on the autism spectrum, I was unaware of the studies saying that autistic children have a hard time wearing masks. Are there any strategies that are available that you would suggest for our children, especially our special ed children, so that we can make it easier on both our teachers and our students?
Sure. Yeah, we've had a lot of success with therapists working with children who have developmental disorders to accept masks. There are masks that are available that have clear, visible plastic part in front of the mouth. And for children where it's important to see facial expressions, we've used those as well. So there are things that can be done to help with that, yes.
I appreciate that. Thank you.
Thank you, Nikki. I think we have Savian and Ali.
I think Ali was before me.
Sorry.
No worries. Thank you very much, Savian, and thank you, Ananda, and thank you all for joining us for this conversation. I want to start my comments and questions by saying I think we have to be sensitive in having this conversation to the fact that our community lost a student to COVID-19. And so I think it's important that we have this conversation while centering our students at East and our faculty at East. Because our community has lost a child, and this is really impacting our staff, their families, in ways that are incredibly painful to navigate. And so I don't want anybody to think that this conversation is completely data driven or we are unattached to how serious this is. I think what a couple of my colleagues have spoken to slightly is that MMSD is an incredibly large group of young people and an incredibly large faculty and staff. And because of that, we have a lot of different medical needs, right? From students who breathe out of a trach, to students who are hearing impaired and read lips, to educators who have all sorts of health issues that need to be, taken into consideration, but also folks who are just like navigating a pregnancy, right? Like a school nurse who's not going to be able to be vaccinated because she's due in August, right? To return for third or fourth quarter. So I think when you look look at kind of the complexity and also look at where we are, which has been described as the height of this pandemic for the state of Wisconsin, that Wisconsin experienced one of our most deadly months in the month of December, and isn't having a particularly phenomenal January kind of recovery. I think it's important to kind of identify what it means to be at the height of the pandemic right now, as we navigate this current moment and navigate the aftermath of December. And I guess I'm curious from our experts how we reconcile kind of where we're at and where we're projected to be in the immediate future, as we have this conversation about what it looks like to reopen. And I'll direct my question first at Malaya, and then ask that Greg and Thomas speak as well.
Yeah, thanks for that. That's a great question, Ellie. I am really hopeful about the near future because we do have 2 very effective vaccines that are available to our highest risk, highest exposure healthcare workers and people living in nursing homes now. And I hope that those vaccines are going to become more available to, at a very minimum, the highest risk age groups in our county in the very near future. And as we start to see more people who are vaccinated, the impacts, the potential impacts of the pandemic will they will abate. It'll get a little bit easier to navigate. And then as we see more and more people receiving the vaccine, I hope including the essential frontline employees, such as teachers, will be in one of the next phases coming up soon. Then we'll also start to see transmission rates going down. And at that point, I think there will be a lot of relief in terms of how we are all facing the pandemic. So it's hard to predict the future. I joke a lot that my crystal ball seems to be broken this year, but we do have a vaccine now, and we can expect things to improve as that vaccine rolls out to more and more people. How long that will take, I think, is a big question mark. And so I don't know when.
I'd like to kind of address the remarks that you mentioned about disease severity in children. Certainly, we were all quite upset about the death of our student here in Madison, and put that in the context of what we're seeing day to day at American Family Children's Hospital, UW Health, and our catchment area is Northern Illinois. Most of about 2/3 of the state, a little bit of Iowa and UPM, Michigan. And I have to say, I've lived through the HIV pandemic, the H1N1 pandemic, and children in general are doing very well with this disease. And that may sound a little shocking, but it's what we're seeing on the ground, that recovery is the rule. And even children with underlying health conditions are being discharged from the hospital quite well. And it's not an absolute. Clearly, there are some children in the world in the United States that have not done well. There are deaths, but these are very, very rare events. Sweden just published a study on their school children and had 0 deaths in their school children cohort, and a number of other studies have supported that as well. And to address the staff issue, clearly everybody's very concerned about teachers and staff. We have a lot of young staff in our nursing staff as well. And I just want to point out that the American College of Obstetrics and Gynecology does recommend COVID vaccine for pregnant women, that it should not be withheld. It's not been approved yet by the FDA, but we are counseling in our institution pregnant women to receive the vaccine, to certainly discuss it with their doctor, receive the vaccine if they're eligible. So I don't see that as a barrier. I think by the time education staff can have access to the vaccine, we'll have a little bit more information and probably a few more other organizations confirming that as well.
And if I could just jump back in to build on what Greg just said, it's true that the vaccines for kids are quite a ways off, but I think that in order to get control over the pandemic in terms of both disease transmission and the impacts in terms of disease and hospitalizations and deaths, we actually don't need to wait for a children's vaccine. I'd be comfortable sending my kids to school unvaccinated in an environment where I was confident the teachers were protected, I was protected, and my kids' grandparents were protected.
I would agree with that 100%, Malia.
Yeah, I would agree too, and pointing out that I have one daughter who's in MMSD and one who will start in the fall. So I would feel the same way. Just to quickly add a couple of points. I mean, obviously the loss of any child and any person is a tragedy, and I think that we have to be aware of that, and that, you know, one loss is too much, right? So, you know, in that vein, I think that we also have to think about there's sort of what we understand now to be the risks and what we understand to be kind of the promise of vaccines. And I think the vaccines that we have are extraordinary, and hopefully, you know, we will see them going into more arms really soon. But I do want to sound a note of caution, because I feel like we're kind of in a race at this point. The data that we're seeing out of England is quite concerning in terms of the rapid spread of the variant that probably arose there and is now being detected in the US. So this new variant virus that you may have heard about is a little bit more contagious than the strains that we've seen before. It is no more inherently deadly. It seems to be no more inherently infectious for kids or anybody else, but a virus that spreads a little bit faster is going to cause more cases, and, you know, the same proportion of those cases will you know, will be severe, and some of them will lead to deaths, even if the virus isn't, you know, more deadly in itself. It'll just cause more disease. And so that may affect the efficacy of some of the interventions that we talk about. And so I think we have to be prepared as new information comes available to adjust our thinking. And that doesn't mean that, you know, the like scientists tell you one thing on Monday and they tell you something different on Friday. You know, I mean, that's because the information is coming out so fast, and we're all trying to make sense of it and you know, do our best to be responsible and not overhype, but also tell you what's, you know, what we understand to be true today. So we do have to watch for new developments and kind of new emerging strains of the virus, which may kind of change our calculations.
I'm sorry, I have a singular follow-up question that's specific to vaccination. And I think, Thomas, what you were kind of alluding to is that if there is a faster spreading variation of COVID, that our ability to distribute the vaccine may not keep up with a more rapid spreading variation of COVID. I've also heard that Wisconsin's rollout of the vaccination, it hasn't been particularly rapid. Can you all speak to that?
Well, I can talk briefly about the you know, this sort of race that I mentioned. So as Malia and Greg said, you know, the more people get vaccinated, the more we're going to begin to kind of see that curve go down more steeply, and so that's what we want. So the more people in the community who are immune because they've been vaccinated, or maybe because they had COVID and got over it, the harder it's going to be for the virus to spread. That's this idea of herd immunity. but the level of herd immunity, so how many people in the community need to be immune before we really stop the spread, nobody knows. But if the virus becomes more contagious, then whatever the bar used to be, it's going to be higher. So that means that if we had to vaccinate 70% of people before in order to really stop the spread, maybe now it's going to be 75 or 80 or 90. We don't know. But a more transmissible virus means that it's going to be harder to get things under control. So the faster we get people vaccinated, both the faster we can get control over the spread, and the more we can control the emergence of new strains that are going to keep cropping up as more infections happen.
I'll just say at a local level, the machinery is turning very, very quickly in all healthcare systems in town. And then likewise at a state level, things are moving very, very quickly to accommodate more and more vaccine. The federal level has been a bit frustrating. We're all hoping for some relief after January 20th.
I think since we raised this issue of the new strain, I'll just say that one of my real concerns is that the new strain, there's some evidence that the new strain is already present in the United States. And I am very concerned that when we have a big shuffling of the people all around the country, in particular students returning to college, that we're very likely to see the new strain come to Wisconsin if we haven't already. And the new strain spreads more rapidly. And so things, as we've seen in the UK, will change quite quickly. And so I think in terms of the school board, one of the things to be sensitive to is the need to make a rapid adjustment to the plan. The unknown about this new strain is really that we don't know why it spreads more quickly. And Thomas was alluding to this idea that as we learn more information about why does it spread more quickly, we might need to adapt those mitigation measures. Like, there are a lot of hypotheses out there. It might have produced higher viral load. It might like snot better. We don't know yet, but whatever emerges in terms of learning about this new variant might have implications for controlling it as well. And those might have real practical implications in a school setting.
Thank you all. Before we move to Savion, Greg and Malia mentioned children. Can you talk about the age group that you were referencing to? What is children age group?
You mean in the vaccine? For the vaccine?
In the context that you were talking about for vaccine and also spread.
Yeah, so in my context, in my world, it's 0 to 18, birth to 18. And even we have concerns of pregnant women, so even prenatally. In terms of vaccine, it's going to be something where we're going to see it kind of go from the older age downward. Adult would be vaccinating infants, but we'll just have to see what the FDA does.
Thank you.
Thank you so much, and thank you everyone for joining us here tonight and answering any questions we may have. I have about, I think, 4 smallish questions, yes or no. Well, I guess one is there any research on the vaccine effectiveness of the new strains? Are we able, is Madison-Dane County Public Health able to micro-target neighborhoods? We are a larger district. Are we able to get data for specific attendance areas? So one attendance area may be safe, one may not be safe, or below the threshold or above the threshold. And then I know that there is a lot of resources required to administer the Pfizer vaccine because it's required to be at a lower temperature. Do you think that our school staff, our school medical staff will be able to deliver the Moderna vaccine? And then one last note, the governor in a letter Friday said that we don't have enough vaccines for our entire 1A population. So hopefully we do see changes at the federal level by January 20.
Can
Yeah.
I take the first
Yeah.
one because it's super easy? The vaccines we have so far are expected to be just as effective against both the UK variant, which is what we've been talking about, and another variant of concern that's known as the South Africa variant. So far that looks good.
As to the Pfizer vaccine, it does require the super deep freeze storage and care and distribution. I know UW Health is poised to be a bigger site than just vaccinating healthcare workers, so offering some community vaccination, but I don't know much the detail of that. In terms of Moderna, offering that in schools, it would be a great thing to consider for teachers and staff. That too does require resources. You need nurses, you need vaccinators, storage, and there need to be some resources put behind that, but that would be a great consideration.
And then I guess in terms of the micro targeting piece, I will say that that requires resources, but we know from all sorts of research, and I don't need to tell you that the burden of COVID does not fall equally across all races or socioeconomic classes or neighborhoods. There was just a paper that came out today saying that that looked at St. Louis and said that although testing was more available in neighborhoods that were more affluent and white, the case burden and hospitalization was greater in more neighborhoods that were communities of color and lower socioeconomic status, and they had less access to testing. And so that's one reason why I think it's really important to try to get some sort of testing out to schools, to distribute it more geographically to places where people might already be able to go. But in terms of like getting enough data out of that to really target interventions, I would love to see that happening, but I'm not sure if we're going to be able to get good enough testing out all over the place to really kind of compare one neighborhood to another. I know that there are attempts to do this, but I mean, I'm sort of usurping like Malia's actual expertise, so I should invite her to talk more about that.
It's an interesting idea to think about how one school might be safe while another school is not. But I think the real challenge to that would be that, in fact, people are not really constrained to their neighborhoods or even to one school. If you look at a family, I was just talking to someone this morning, in fact, whose partner is a teacher at East High School and has 3 children, each of them in a different school, not East High School. So just in her household, she's actually in 3 different schools. And so micro-targeting a neighborhood would be amazing, but it would require a level of invasiveness into who we all interact with that probably is impossible. And in fact, probably nobody wants.
Thank you. And I guess my final follow-up thought would be and especially for our school administrative team, is to think about, considering reopening, what would the resource costs be to potentially having to close again? Not just dollars and, transitioning from everything in person to online, but, just the disruption to learning that could cause as well. And so consistency is something to think about as well.
Thank you, Sylvia. Gloria?
Hello, everyone. Thank you for being here. It's so nice to see you again. I know we had an opportunity to chat, believe it was last week, and I'm going to ask a very similar question in my focus area from last time, just so my colleagues can hear and the community can hear. So it is really somewhat what Savion was getting to with the micro-targeting, but really focused on our how COVID is impacting our communities of color, and how you all recommend, or if are recommending. I know that when we talk about public health, we sort of talk in this sort of like everybody, right? We're going to cover everybody, but the reality is this is impacting our Black and Brown communities, our Latino, Latinx communities, our Black communities, and wondering what recommendations you have, or what kind of work sort of really targeting that, and how school districts and communities should respond to that. I guess is my question. Yeah. And I don't know who wants to answer.
Well, I can take a first pass at it, just from my perspective. In terms of the health disparities within, and the risk disparities within our district, the thing that troubles me most about the idea of reopening schools is certainly not the risk to kids, because as Greg has said, it's the risk to the two children in terms of getting COVID is quite low. But I am very concerned about kids who live, especially kids who live in intergenerational households. Those are the same kids that are already more likely to be economically disadvantaged and socially disadvantaged, and Black and Brown. And so, I was really gratified when Dr. Jenkins called me up to talk about this, because that is truly, that to me, that is one of the foremost risks in my mind. And so I think erring on the side of caution when we don't really know a lot about that within household transmission that stems from school settings is protective of our Black and Brown communities.
And I guess my question and follow-up is, are we talking, when we talk about sort of our recommendations from the experts, are we talking about that so that in spaces where the community, the entire community can hear, right? Because I think, as I said, we often are making decisions and reviewing stuff based on the majority of the population, and wondering if we're having these targeted conversations with our community so that everybody really understands how this is impacting our Latinx and Black community.
Yeah, I can address that to some extent. I know two members of our department, Dr. Cheryl Henderson, who's also a pediatric infectious disease specialist, and Dr. Jasmine Zapata have reached out to at least the African-American community. And their focus right now is vaccine and vaccine acceptance in particular, but also other issues surrounding COVID as well. So there has been some outreach, and I am certainly available and happy to help with those needs as they arise as well. This is a big concern. I'm glad you brought it up. I mentioned when we spoke earlier this week that we addressed this issue with our school nurses statewide, and disparities in children of color are much greater with COVID in terms of hospitalization rates and even disease rates. And so we share those same concerns, and also vaccine availability, testing availability, as Tom pointed out.
Yeah, I mean, and I think it's important, right, for not only the direct sort of communication to our Latinx and Black community, but also our entire community, so they really understand how their actions and decisions can negatively impact worse to our Black and Brown students and our families. And wondering if that conversation is happening.
It's a great point. And in this school context, it's important to note that community transmission drives school transmission, not the other way around. So, if you don't want disease in the school, you keep it out of the community, and behaviors like mask wearing, public gathering, traveling, all those things that are going on in the community negatively impact the school population and disproportionately negatively impact communities of color.
No, I think that's true. And I think, that's been part of the conversations that I've been a part of with the district, throughout. And I think it's important for everyone to recognize that the burden does not fall equally. And so we really need to get those messages out there that, I think everyone wants their kids back in school. I don't think there's anybody who doesn't want their kids back in school, right? But people have legitimate concerns about what the impact on their household will be if their kid comes home with COVID. And not everyone is thinking about that in quite the same way. So I do think that we are doing our best as the UW folk to be aware of that concern and have it inform how we think about how we're going to interpret all these data. So we are being driven by data, but like the interpretation also has to be influenced by the human condition, and I think we're trying to take that on board. And I will just second what Greg said. Like, I am happy to talk to anybody who wants to talk about the science of COVID, or has questions, or just wants people on the scientific side to understand where they're coming from.
Great.
Gloria, to talk a little bit about this issue of, are we having these conversations in a public way so that everyone has a good understanding of who we are, who is most at risk, and what these decisions are intended to produce in terms of protecting the most vulnerable. In my experience, it is very hard for humans to wrap their heads around the idea that my actions are part of a greater whole, a dynamic, interplay between everyone in my community. And it is doubly hard for most of us to understand that my actions can have a worse impact on someone else other than me, right? It's just a hard thing for people to wrap their heads around. And so if there's a way to help with communications on that front in particular, I would be very happy to do it. But it's a real challenge. And the other thing I just wanted to add is that in terms of public health, actually health disparities and racism as a systemic cause of health issues is definitely part of public health's core framing and foundation. So it's part of the conversation on the expert end. Whether it's part of the conversation in public, and whether your constituents understand that this is one of the reasons to not reopen schools for this semester is, that's a bigger challenge, I think.
Yeah, I agree. Thank you so much for your answers. This is a racial equity in an equity, right, for our community. It is across the board, right? It is health, it is economic, it is education achievement. It's impacting our most vulnerable families and students. And our community, as progressive as we say we are, this is the moment in time, right, to really organize and really understand how inequitable, COVID's impact has on our Black and Latinx communities. And so, and I'm not saying, and our most vulnerable, really underlying health conditions, right? It's impacting our most vulnerable communities. And so I just really, for those who are listening in our community, I think this is the time for us to come together and really listen to our public health experts and guidance so that we can all come back to school. But in conversations with Dr. Jenkins and who he has been engaging with, our Black and Latino families are saying they are not going to send their kids to school at this moment in time because they understand the health implications on their students and their families. And so thank you so much for answering that question. And I'm done. Ananda.
Thank you, Gloria. Savian, you have a quick follow-up?
Yeah, sorry. This question is for Dr. Greg. I do not know how to pronounce your last name, but I'm curious. COVID, as much as it is a physical health crisis, it also has a huge psychological impact. Before COVID, we had increasing rates of students reporting anxiety and depression before, and so I'm curious if you have any insights on what it will take for our students to recover from this extended period of virtual learning and isolation.
Thank you so much for bringing this up. It's a concern that people working in pediatric health, pediatric mental health, are very, very concerned about and paying a lot of attention to. I'll just tell you some local data. A colleague at mine at UW Health looked at the past year, and for anxiety and depression, our visits to the pediatrician or to any healthcare provider have doubled for children. This is less than 18 years of age, with a sharp spike in December of 2020. My hospitalist colleagues are reporting a large increase in admissions for self-harm behavior to the hospital. And so this period of isolation, of stress, is of great concern. And what the causes are to that are it's difficult to tell. Is it not being in school? Is it the social isolation? Is it the fact that your parents are stressed because they lost their job, or mom or dad has COVID, or you lost a family member? It's probably multifactorial, so it's difficult to know. But we know that teenagers in particular, school-age children, need to be around other children. That's very important in their socialization process, and that this isolation has to be affecting them in that way.
Thank you, Savian. So it's my turn. The hard thing about being the last person is that, and this is the second time, by the way, that I'm watching you all today. I watched the video before this meeting, and I feel like I have a lot more questions. And I have this list of things like, okay, test, and then cross, and then vaccine. So I want to start by saying that I'm originally from Brazil, and I'm home now with my family. Things here are really strange because I'm in large cities. I'm in Rio, and now today I'm in São Paulo, which you probably know has been deeply impacted by COVID. One of the things that we were doing, we were talking about every day is our ability to smell. Like every day would wake up and like, okay, am I still smelling things? And it made me think about the home screening that is in our presentation. It made me think about how people are navigating screening in general. All the stores, all grocery stores, shopping, anything, you have temperature checks. And I'm thinking about also how we're navigating that culturally. Greg, you started by saying how many things you have survived. So I'm also, when I was a child, it was dengue. And then, we had spots of malaria, we had spots of polio. We have so many things that it's foreign to US folks. And then of course, Zika, and now Corona is hitting Brazil pretty strong. I wanted to also kind of wrap this question also in the cultural way, and how you all have been, if any of you have had exposure and how people from other countries are navigating, in particular families are navigating the disease. I've seen reports from many different countries in Africa, because they have survived the Ebola and so many other viruses. Their culture around masks and around screening have, are very different than ours. Yeah, so I'm curious of how this what self-screening looks like. This the temper check is something for us to consider in our home kits as a viable thing to be doing, and at the doors of our schools and the doors of our buses. And what does it look like, this culture shift of daily, all the time, face covering, hand washing, cleaning, and all of that?
There's a lot there. I appreciate your perspective, and really interesting. I think you have better internet right now than I do. Mine just dropped out on me. I'm in rural Dane
my brother
County.
is in IT, and I think he has one of the best internets of all of us together.
That's great. Yeah, so the cultural aspects of this are tremendously huge, and certainly important to talk about and address, and particularly in how it relates to screening, like you brought up. It is interesting how we've adapted, all of us have, right? You automatically now stand 6 feet away from somebody in line at the grocery store. And I think I've seen children just do that automatically. Or I walk into a room and they pull their mask up in an exam room. So people are getting it and understanding that. In terms of some of the specifics of screening, the temperature checks have a lot of there's a lot of visibility. They've turned out to not be that reliable, honestly. UW Health abandoned it for their employees. We just ask if you've had a fever, but we no longer take temperatures. The ones where you shoot it at their forehead have turned out to be unreliable. Too many false positives, too many false negatives. So the questions, though, I think are really important. If you've actually taken a good temperature at home and have a true fever or lost a sense of smell, turns out to be pretty specific, not incredibly sensitive. And then the other symptoms of cough and other things. I know the administrative staff has done a marvelous job in getting together the program for doing self-screening for students. And maybe Andrew can speak a little better to that in terms of some of the specifics to that, but I've been quite impressed of the program that they have in place.
Thank you, Dr. DeMaria. I actually asked either Jay Affold or Sally Zerbel-Donich to join us to talk about a bit more around the screening. However, our online screening, our application, does ask a whole series of questions, again, aligning to best practice, and provides an answer then whether or not it's clear that a staff member or student would be immediately eligible to report to a building or join for in-person instruction, but also very importantly then contacting school health staff to work out alternatives and best approaches. Sally, I see you joined us.
Yes, we've been really doing family symptom screening and staff symptom screening since June when we began our MSER CARES program. And so what we're moving to now with this program, Qualtrics program, is just a more sophisticated program. And, as we prepare to bring more staff and students back. So yeah, I think it's very important, and I think we're going to need, education for both our staff and students as they return, and the importance of completing that. So I know, as Greg said, the CDC just highly recommends that this family screening is done and staff screening prior to folks coming into the building. I also want to say we in the nursing staff are really working with families, and we have some funds from some grants and otherwise to make sure that every family has a thermometer, because it's amazing how many people don't have thermometers and don't know how to use thermometers. So that's kind of some of the work that we're doing right now to make sure that families have the ability to do some of this work at home.
Thank you so much, Sally, for joining us. I'm wondering if Thomas or Malia have anything else to add.
Not much to add on the home screening front. You know, I think that we've covered that pretty well. I think that you know, again, we have to consider the risks of asymptomatic transmission as well as symptomatic transmission. We have to recognize, I think, that we're not going to catch all. I mean, that none of these things is perfect. I'm sure you've all heard of the Swiss cheese model of public health interventions. So basically, you know, each individual slice of cheese has holes in it. So each individual thing that we do, whether it's home screening or, you know, symptomatic testing at school or masking at school or whatever, each one of those things isn't going to stop all infections by itself, but hopefully the holes in each slice don't all line up. So you get a virus going all the way through all of them. So the goal really has to be kind of a multi-layered strategy that we can use to make the school environment as safe as possible for everybody. And I would just underscore that, you know, in Brazil also, I know there's a lot of transmission happening right now, and there's, you know, some variants, you know, new strains emerging there that people are concerned about. And so we're, you know, that's another example of how, you know, anywhere in the world this could happen and could kind of change our calculations as we learn more about how the virus might be changing. So that's something that we have to be open to.
Okay. So my second question was around vaccines. So one of the things I was hearing from you all is this hope around the vaccine. But I know a little bit about the history of vaccines in this country, the amount of time that has taken to not just only distribute the vaccine, but to be effective, to find, you know, the vaccine with a more comprehensive ability to address the multiple strands and the changes and whatnot. What are we looking for timeline? So if we were to have 100%, if we could say everyone would get vaccinated or would have a vaccine available over the next month, how long does it take for us to test out all those vaccines and those multiple strands until we be able to really address I think, Malia, you were talking of like how even in the phase 1 that you can start seeing the decline. Is that decline significant? When is the decline going to be significant? What we're looking at as far as timeline?
Yeah, it's going to be a gradual emergence of the benefit of vaccines, because it will necessarily be a gradual rollout of vaccines to more and more people. And at least from where I'm sitting, it's very hard to predict, you know, are we looking at April or are we looking at August or what? It's very hard to say what the timeline of that rollout is going to be. What we do know is that the vaccines that have been have emergency use authorization now are extremely effective at preventing people from getting very sick from COVID-19. And so, you know, hopefully we'll have more vaccine candidates come to market, and they will be they'll also be very effective. And so we'll slowly start to get control over this. But in terms of when, I couldn't say. You know, I'll say one last thing. Once we have the people who are at the highest risk of being hospitalized covered, I'll breathe a big sigh of relief. You know, once we've got a sort of a base of people who are over 65 and have a serious comorbidity, I'll feel a lot better about prospects for 2021. So the threshold I'm looking for is not, I would love everybody to get vaccinated, but it's sort of walking down that ladder of risk. And I'll start to feel a lot better when the age groups and comorbidities that are highest risk are covered.
Yeah, if I could just add on to that. First of all, you're talking to a guy whose arm is sore because I just got my second shot this morning. But I would say, the vaccine rollout has been a massive undertaking, a huge project. I'm very confident in the safety and of the effectiveness of the vaccines that we've seen so far. And there are going to be a lot more coming. I want to be a little blunt with you, though, and tell you to not hold your breath. And that has been based on my experience with vaccines, over the past 20 to 30 years, and particularly over the past 10 years. Tom mentioned earlier, and Malia could probably speak to it as well, the level of herd immunity we need to really see a drop in disease. I don't think it's known. The number 80% is out, and it's mostly, I think, pulled out of thin air as well. But we need a lot of people to take this vaccine. And there's a lot of discord in our country right now, and that's going to bleed over into vaccination policy. And I'm really worried about that. And I'm worried about vaccine refusal, conspiracy theories, and all these things that are going to affect vaccine uptake to the level that it's going to impact you guys and our students and all of us. If we hit that 80%, I would absolutely love it. I think Dane County will do well, but I'm worried about the rest of the country.
I agree with that. I would just jump in and say a couple of things. So first of all, I think it's going to be really important for everyone who feels safe to do that. I mean, the vaccines are safe and effective. They're incredibly safe as far as we know. I'm excited to get vaccinated when my turn comes. I actually am colleagues with some of the NIH scientists who developed the Moderna vaccine. They're incredibly smart, dedicated people, and I know and trust them. So I think it's going to be important for us to work through our social networks and tell people that this is something that they should do, not just for themselves, not just to protect themselves, but so that our kids can go back to school and we can all sort of get back to a normal life and you can hug grandma again, and we can protect the most vulnerable people in our society, right? So like this is a civic duty, not just something that we do to help ourselves. And I do, however, want to sound a note of caution that we are kind of in a race. So there's information that colleagues are sending me about especially about Brazil, actually, saying that there's a new surge in Manaus in Brazil where there was a lot of infection earlier in the year. And so if there was ever a place where there might be natural herd immunity, that would be it. There was a study that suggested maybe half of people in Manaus in the city had gotten infected. And that's not enough to stop a new surge from happening. So we need to get way above that level, whatever it is. And the only way to do that is to get a lot of people vaccinated. Unfortunately, vaccinating 300 million people in our country is just going to take a long time, at the best of times. And because of the way things are administered, because it's the responsibility is in state and local health departments, and each of them is kind of solving their own problems. It's just going to unfortunately be kind of slow and disorganized, and because people have concerns about vaccine, everybody who feels safe doing it really needs to be able to do that when their turn comes, so that we can hopefully turn the tide.
Thank you so much for the three of you for joining us. I do want to remind Thomas, we have you on record saying that you wanted to talk to anybody at any time. I don't think you know, we're receiving about 1,000 emails a week about people having very similar questions that we asked today. So I think Dr. Jenkins is going to put you on a schedule for on-call responses to so many people. This was extremely enlightening to me personally, and I'm sure to a lot of my colleagues. And I'm hoping that we'll, at the very least, make sure that we have a clip of this meeting again to put on our social media, so our families and our students get an opportunity to hear from this wealth of information. And you're right, Thomas, like things here in Brazil are extremely complicated. It has to do a lot with education. So I'm also thinking about our role as an education body around educating our families, informing our families, what's really happening from the place of truth and fact. And I think that is an important role. I see that Christina has raised her hand. I'm gonna give an opportunity for real quick, Christina, if you don't mind just being really succinct and direct.
Really quick and direct. I just wanted to see if our experts could weigh in really quick. We talked a lot about vaccinations and testing tonight, but we didn't talk very much about the very real mitigation strategies of wearing a mask, distancing 6 feet, the cleaning procedures and policies that we're talking about and putting into place tonight that are going to reduce the risk a lot. And so can you give maybe a relative thought on that for us as we close out this part?
Sure. And remember, I mentioned the icing on the cake. The cake is wearing a mask and distancing, and disinfection, a smaller portion of that, but also important as well. There's a great study out of North Carolina, another one out of Mississippi that looked at effective measures in school systems and consistent mask wearing by staff mostly, but also by students, was associated with much lower rates of infection in kids in those schools. So we know masks are very effective in schools. We know that social distancing as much as possible in schools is very, very important. Those are the cornerstones of any COVID mitigation policy.
Thanks.
Anybody else final thoughts? Andrew, I think you are the person stewarding our guests away from our meeting. Is that correct?
I'll defer to Dr. Jenkins first.
Yeah.
Oh, yes, Dr. Jenkins.
Yeah, no problem. First of all, just thank you to everyone. And Ananda, just so that you know, we have our Facebook Live family engagement conversation coming up, which Gloria and Ali are going to be hosting that. So we've asked our guests to come back so they can speak to even a broader audience. I just want to lift one thing tonight. When you go back tonight, reflect on this conversation. You were at a point where there was the highest degree of human decency conversation taking place. You were talking about being responsible for others. The way Malia went into the piece in terms of just the racial disparities, we have to have that conversation, and we can't have them in isolation. We say we're an anti-racist district, then we have to be about it. We just can't have one side of town talking and leaving out the other side of town. We're Madison. We're supposed to be this progressive city. A part of being progressive is putting it on the table. We have an opportunity to show not only just the citizens of Madison, but the nation right now, how you can remain civil in a conversation that's very complex. I just want to say thank you to all of you for being here tonight and your contributions. But let's not be afraid to put it on the table about the racial disparities. They're real, and they're not just one group's problem. They're all of our problems. And trust me, if we don't deal with it all together, you will perish because of it. Simple as that. Thank you very much.
Thank you all. We're gonna do a 5-minute break for stretching and saying goodbye to our guests. And we'll come back in 5 minutes. Thank you all.
Thank you guys.
Thank
A
you all
rock
so
star.
much.
Thank you for having us.
Thank you so much for joining us.
Thank you.
Thank you.
Listen to Malia's podcast. It is really great. Thank you.
Your pandemic, in case you're wondering what it's called.
Okay, Ananda, we have 3 more items to go. That was a big topic, huh?
Well, and I hate to be this guy, but we're not done with that one yet.
Yeah,
We actually have our policies to introduce as well.
Yes.
So, yeah.
That's true, Andrew. True.
Yeah. I think we can make short work of it, though. Confident.
Yeah, no doubt. But this is very informative, and our community needed to hear this. This is a pretty serious topic, and I think it was a lot of good questions asked tonight, and just having those experts. And they've just been awesome, though. They really have. And Andrew, thank you for the way that you've been shepherding this with the entire team.
Nanda, nice work on handling it. I know there are a lot of different opinions. The reason I asked on the autistic students is that came up when I was running for assembly on whether autistics could wear masks, because it was a huge discussion. So I just wanted to work some strategies, because I didn't want a lot of people to wonder, will kids be allowed to go back?
Yeah, I'm your esteemed colleague, Nikki. I noticed you're like, oh, Nikki has something to say about that. So
yeah, you know me well.
I knew you were going to want to weigh in, and couldn't wait either.
Yes,
so
I was trying.
No, that was fair. No, it was a really important question too, and timely. So thank you, Dr. Jenkins, for bringing our guests, and thank you, Andrew, for framing the conversation too. I thought it was really helpful.
Yeah, it was the whole team, and I tell you, our nurse Sally and Jay, the work that they've been doing on their end, they've just been phenomenal too. And so, she's tough. She holds us accountable right there in the conversation and staying focused on the science. So I appreciate Sally having to have come to the meeting as well.
I love how she's no nonsense. This is how we're doing it. This is the science. This is what it says, and that's that.
Yeah, she's pretty tough.
Hey, Savion, will we see Hamilton the cat tonight?
He's laying down right now, so no.
He is a cutie though.
Yeah, I'm not getting all this cat hair on my
Oh
shirt
yeah,
tonight.
that makes sense. But he is a cute one.
Nanda, really though, thanks for, just letting it go on like that, asking those questions. So I feel like everybody got a chance to put their questions out there. And those are really good questions too. And just the way you guys have been as the board of just trusting our people. And we have a lot of good staff who've been working very
Yeah.
hard on this. So thank you.
I really, what I was thinking, because I feel like, I know we have some talking points, but like having some sort of FAQ, like collecting what are some of the things that people are asking us the most. One of the questions that I had that afterwards, like it was irrelevant, it's like the hybrid format, potentially the conversation about hybrid will be relevant at some point, but currently, it will cause almost the same harm than we would if we were 100% open. So, I mean, even some of those, sort of the top questions that we get when folks are asking, how can we have just an auto reply? Here's the most common questions, and why are we making the decisions that we're making? I am thinking about like the role we're playing around disseminating the information.
Right. Well, the platform you mentioned, Let's Talk, that's online now. And the way that it's set up, anyone can go in and put those questions in online, and we'll be giving out those responses. Now, for sure, some of the things that we have not made final yet, we won't respond to in that way. We'll just let people know where we are. But Let's Talk, it's online, and we could get to that. And our hope is to continue to come back each month. We have to continue to update, but even during the week, as Andrew had said, we meet on Tuesdays. As we get more information, we will continue to communicate it out.
So I see that we are still on YouTube live and recording.
Oh,
Yes,
okay.
we are. We didn't recess, so we're still on, and we're now waiting for Andrew. Everybody's here, Andrew. And I think Andrew's gonna talk to us about the survey.
Yeah, I'll only hit a couple of highlights, and rather than go with the screen share and take the time for that, I'll just hit a few highlights. It's important for us to recognize that we have our community factors and our own strategies, but then also what is the interest level of our families and our availability of our staff. So we fielded a survey in December to ask those very questions. And you'll see in the PowerPoint that walks through the metrics themselves and as posted to our website on reopening plans, you see that some of these family preferences and student preferences have flipped to green. So they're in the 40% range in terms of the number of respondents indicating that they'd like to come back. Similar to our earlier conversation, there's no magic number. Is it 33% or 35 or 50? The important thing is that we have some idea that we're headed in the right direction. And certainly, once we have a specific opening date and a really clear vision of instructional design and what's going to happen if you choose all virtual or remain all virtual or choose in person, then we would again then field a mini app. So similar to a very, very brief enrollment-like process to get a really clear number of where our students lie. Now, when we closed, we had talked about the equity issues that we have, a disproportionality around the impacts of COVID-19, particularly among community of color, multi-generational families. Income is another factor. And I will point out that there is another document in tonight's packet that gives you much more detail around those survey results, and you see those same dynamics playing out. So you see preferences for remaining all virtual different from those expressed to begin in person. And you see those playing out among various race, ethnic, and other demographic categories. Another set of metrics then we have related to staff availability. So this is piecing all of the puzzle pieces together to make sure that we have sufficient staffing for the model that we're implementing, as well as clear and broad communication of the instructional methods that we have planned. So those are works in progress, similar to some of the others that we had seen this evening. But the balance of this agenda item then is to take a look at the 3 policies as required by Public Health Madison-Dane County as it relates to cleaning and I'm going to ask as I'm setting this up for Sherry to come join us, around cleaning, around, I look at these all the time and I've blanked it. Absolutely. I'm just going to hand it off to Sherry and get out of the way. Thank you. Sorry.
Andrew, thank you. It's funny that you did that. I do the same thing. I know at least one of them, but the other 2 I normally can't remember. So we have facility cleaning, the hygiene policy, and the protective measures policy. All of these policies were essentially drafted from our reopening website because we do have all of that information contained in various places there on that landing page. I also consulted with primarily with Sally Zerbel-Danish, our district nurse, to make sure that I was covering everything that would be necessary for us to be able to implement these policies immediately upon return. And pretty much, I think we've covered everything that would be needed and everything that is required by public health. You will note that unlike many of our other policies, these are very short policies. And in many ways, I did take time to explain that these policies not only would apply during COVID, but could apply, you know, in our general everyday school scenario, such as the hand hygiene. There are expectations around hand hygiene that carry over not only during COVID, but just in our everyday interactions with others. And so when you're reviewing these, if you have any questions about, you know, why we used or added particular language, please feel free to let me know. And it is expected that you will vote on these at the regular board meeting on January 25th.
Thank you so much, Sherry. We're gonna do the same thing, do the round robin, see if there's any questions around. We're discussing the 3 policies together, right, Sherry? Okay, so let's do Savian, Nikki, Gloria, Chris, Ali, and Christina. Go ahead, Savian.
Thank you. Yeah, I read the policies. I trust the school staff, especially our school health professionals, and trust that they've been and know that they've been informed by our public health guidelines. But if I have any further questions, I will certainly email y'all or raise them in briefings.
Thank you.
Thank you, Savian. Nikki?
Unmute. I read the policies. I agree with them. I think they're well written. My only concern is if they can be, for special ed students, they can not, I don't want it to be subject to suspension or anything like that if it can't be done.
These policies really don't deal with discipline. So I don't think that's a concern we need to have. We're not looking at any exclusionary practices for students based on these policies.
That's what I figured, but just wanted to check just in case. But otherwise, I thought they were great.
Thank you.
Thank you, Nick. Sherry? I'm sorry, Gloria, Chris, and Ali, and Christina.
So my question is just a quick question. I'm not seeing in the policy any language about when a person, or if and when a person is diagnosed with COVID in a particular area of our school, and how per policy we would manage that.
Actually, that was left out on purpose because that's more of a practice. And as you know, during this entire pandemic time, things have changed over time. And I don't want to be in a position where I'm bringing back policies repeatedly because things are changing as we progress. And so that is covered in the reopening guidance document that was developed. And it's also contained in various places on the reopening website.
That's the same for people with symptoms, right, Sherry?
Yes, I do list, what you're supposed to do, which is to, take the symptom screener and participate in that. However, I don't specifically list what the symptom screener is because, again, it'll change over time, I'm sure.
Thank you, Sherry, for that. Yep, I understand that.
Carusi?
Thank you. So in the protective measure protocol, I would actually like to see stronger language around people who aren't able to wear masks, perhaps reflecting what Dr. Murray talked about just a little while ago. I think adding language that we will work with our, particularly our special education students with disabilities to help facilitate mask wearing as much as possible. And again, Dr. DeMurray might be able to give us more specifics if we want them. I also think that if people are truly unable to wear masks, and I don't think that will be very many people, we might want to say something about testing requirements, because having people without masks in school buildings, even within, 6 feet of others, is a risk. And I wonder, it wouldn't probably cost MMSD that much to test folks who truly can't wear a mask 3 times a week to ensure the safety of the community. I think that we should offer face shields to all staff who want them, not just staff who need them based on their job description. I know that eating and drinking, particularly drinking, is kind of verging into the land of practice as opposed to policy, but drinking water feels like it sort of lands in both. Like if we don't want people using drinking fountains, how are we going to make sure that like people have the basic need of water met in our school buildings in a safe way? So those are my comments on that. I thought the other 2 policies looked fine, and thank you for your work on them.
Okay, thank you.
Sure, I have a procedure question. Are you taking those into advisement and follow up?
Yes, some of them I've already discussed with Sally, so I'm sure we'll be in discussion to determine how we will work through that. As far as the provision of PPE, as I said, that'll change over time as well. I can certainly put language that it will be available, but I don't want to put the district in a position to promise that something will be available and we find that it's not available. So these are, again, just general guidelines. If there are enough face shields to provide as needed, then certainly we can do that. But I want to be careful about over promising in a policy, and we're still in uncertain times.
Thank you.
Ananda, I also have another quick comment or question, which is that I just had some overarching comments about reopening schools, and I don't know if I should save those till later or provide those now.
Let's just wait until we do the policy. Yeah. And then I see you, Nikki, Ali, Schmidt, and then Nikki.
Yeah, I think that a lot these policies really touch on some of the more basic elements of what we're trying to accomplish in terms of making our schools as safe as possible. I want to appreciate the work of our custodial staff and the labor that goes into operationalizing these policies. I think one of the things I think is really useful for the community, and Sherry, I'm not sure if you or Dr. Jenkins would want to speak to this, but really what it looks like to pass these policies at the board level and operationalize them or further operationalize them throughout the district.
Thank you for those comments, and I totally agree. That's what we're trying to do here with these policies, and I think that they're written as such. And I would say, as Sherry has spoken, that we're in uncertain times, but it's enough right now for us to continue to try to reinforce it and be able to do it without boxing ourselves into something that we can't necessarily sustain.
Was it me or Ali? I don't remember.
I think it was me next, so I'll just go really quick. I'm not sure where, if Ananda's having technical problems there. Sherry, thank you for the work on this. Really important to get these policies in place. I guess mine is more of a process question, and I'm glad to hear that Sally has obviously been very involved in the development of these policies. I'm just wondering if we need to pass these through. It's kind of what Ali was getting to in the operationalizing. Do we have like a group of principals, teachers who can take a look at these and say, you know, the way this is worded may be a particular issue as we're looking at implementing this? Do we have an advisory committee that might be able to do that? Or, sorry, you changed places on my screen there.
Because these it's not the technicality, but it's more based on what public health said we had to have in the policies, and that's exactly what's in there. So my fear in allowing a large number of others to review it when we all know that these are the basics would lead us to be, you know, enter into policies that might not cover the absolute necessary items that we have to cover in a policy. And I don't want to, again, venture into the operations end of how we implement the policies.
Okay, thanks for answering that question. I appreciate that.
I just have a question on Chris's question.
Go ahead, Nikki.
And that question is, I understand the additional testing if you can't wear a mask. How do we do that while protecting student privacy? Because there are individuals who can't wear it who may look neurotypical. You may not know certain things. How do we still protect that at the same time?
I would think that others would have to address that. You know, I'm only here for the policy. As far as FERPA, we always adhere to FERPA regulations. And so even a person that can't wear a mask, we're not going to put them in a situation where they have to advertise why they're not wearing a mask.
That's what I needed to know. You nailed it. Thank you. That's all I need.
Great. Who's next? Who was next?
I think that was everyone.
No one was next. Okay. Great. So if you do have questions between now and our regularly scheduled board meeting, please get them answered so that we can be prepared to vote on it at a regularly scheduled board meeting. I know it's tough. I mean, I even got caught up on sort of really deciding which is policy and which is, which should go on implementation. And so there's all around this topic, there's such a fine line. And so thanks, Sherry, for being here and answering those questions. And so we'll move on to the next item.
Gloria?
Yeah.
Before we go, can I ask a quick question of Andrew? We sort of flew through that survey thing about the family survey, the student survey, and just wanted to ask a quick question. Sure. Looking at the family survey in particular and information that got added on the demographics, and to me, the data looked like no matter what the demographics was, it was pretty split, like 30 to 40% either wanted to stay virtual or come back in person, no matter what the demographic was. So I'm just wondering if you can speak to that a little bit, because to me, that has implications for us moving forward and basically needing to provide options for families when it's safe to do so.
Sure. Yeah. Let me start by saying, kind of highlighting what's here and what's not here. So we had a 60% response rate. So 40% of our families did not indicate where their preferences lay. And it is true that we're about 38, 39, 36%, pretty evenly shared by sentiments for preferring in person versus remaining all virtual. But of course, we're also then looking at 26% of our families not knowing at the time they took the survey. So those families could go one direction or another. When we talk about the race ethnic breakouts, what I'm focusing in on, for example, is yes, you may have among African-American responses, again, we don't have responses from all families, but among African-American or Black responses, 38%, about evenly split between wanting in person or wanting to stay all virtual. Same really playing out as for Hispanic respondents, Hispanic and Latinx respondents, exactly the same rates, even about 38% evenly split. But if you look at our white family respondents, 31% would want to stay virtual, and then 41% would prefer in person. So you see a different dynamic play out. And when you see this kind of a difference play out, particularly for our white respondents, which are so a volume of responses many, many higher. So you've got 2,500 responses roundabout, indicating that they would want in person. Meanwhile, you've got 300 or 500 responses for African American and Black responses. So you see those play out. Similarly, if you look at ELL respondents, 40% of our ELL families saying they would want to stay all virtual, 35% staying virtual as a non-ELL respondent preference. So you see these differences between ELL, not ELL, low income, not low income, where we then see 40% of our low income respondents then indicating remaining all virtual as a preference. That would be down to 33% for not low income, preferring all virtual. So you see these dynamics playing out in that way. And it is, again, it's a representative sample. Well, there's some faith we can put into those responses, but we see some of the same dynamics in terms of concerns raised. Dr. Jenkins doing his own outreach, many of us having our own conversations. We're seeing it play out in the data as well.
All right, thank you. That helps. I just think that in those demographic groups, having chunks of 30, 40, and then, 30, 20 to 30 in the middle that are still uncertain just is really important for us to look at in the big picture.
Yeah, and then I also just, Chris, before I turn it back to Ananda, is really understanding that the families who do not respond,
Right.
And yeah.
Right. This is just looking in the context of families who did respond to the survey. Correct.
And real quick, I believe we lost Ananda. Procedurally, how do we?
She's here.
She's back.
I'm
Okay.
back.
Yep.
I
Go
found
ahead.
I'm sorry.
We are done, and
Hey.
we are ready to move on to, I thought we were done, but go ahead.
Yeah, I'm done.
I can resume. I see Chris' hand, but I do have a question about the policy before, so I don't want to lose Sherry. So let's just finish up this conversation. Yeah, go ahead, Chris.
So my comment is not related to policy. So if you want to do your question
Yep.
first.
Oh, let me do my question. Two questions, Sherry. One is around, I think Chris may have mentioned like a little stronger language around what I understood was like around using the mask. So something around like using masks at all times while indoors or in buildings. I'm curious about how you're negotiating eating and sports activity.
Sports, I didn't touch at all. There is an athletic code of conduct, and so we would have to work to get that interspersed. Again, I wanted to try to keep these general and high level so that we wouldn't have to go back and change them consistently throughout time. And so though, for example, sports is addressed in another arena, and it's laid out such that people would know that's where you go if you have a question about sports interactions. And I'm sorry, what was the first part of your question?
Eating.
Yeah. Sally and I can work and figure out something around eating, again, with the idea that I want to kind of keep these high level. And so that's more around the operations end. And so my plan with these policies is to put them on the reopening website as well. And so it is likely that I'll place these and then have additional information based on what you guys have brought up at the meeting that aren't necessarily part of the policy.
Yeah.
And Sally, I see that you've unmuted.
Yeah. No, I agree with you, Sherry, that a lot of, I think that piece is the operational piece. And yeah, and so, we can certainly discuss that further. And I know that will be in more of the reopening guidance that's coming out in the next few weeks. So.
Yeah, thank you. I do think that giving having the strongest possible language from the very beginning is important. One thing that on the airplane, what the person said to us is to keep our masks on like all the time, unless we're actively eating. So which is another thing that I've noticed here, where people would get somewhere and then they remove their masks because, there's this, I don't know, this thing that people think that, you can wear masks sometimes and other times not as much, or halfway through take the mask off or down. So those are my only comments, but thank you so much. And I'm really sorry. I was bragging by my brother's connection and I lost for a minute. I believe that we were at Chris Peruzzi.
Thanks, Ananda. I just wanted to lift up a question that Malia Jones put out during our earlier conversation. That question was, are we having these conversations in a public way? I'm so grateful tonight that we got to have this conversation in a public way. As has been said before, this wasn't just important for the board, this was important for the community to have us have this conversation. And so, Dr. Jenkins, I really want to thank you for your leadership and Gloria and Ananda in making this happen tonight. I feel like it was valuable, and I also feel like it was long overdue. I would also like to put out there, however, that I feel like we need to be having more conversations like this, even if they take a long time, because we're in the middle of a pandemic, and we need to be having them before decisions are made about reopening schools versus staying virtual, not after. Just because I think it will help the community, ground the community in the science and the equity behind the decisions that are being made, and it will help all of us work together better as a team in making these decisions and communicating these decisions to the public. I think another reason why we need to be having these conversations before decisions are made is because I'm hearing a lot from the public about lack of communication. And we're getting, anyone who's read the hundreds of emails we've received there, people have a lot of questions. And the more we talk, I think the more confident the public will feel that their questions are being addressed in a public way by the Board of Education. I also know that we've heard from members of the public who feel that the Board of Education needs to be involved in decisions about whether to be virtual or to reopen. I looked at school districts across Dane County. I didn't look at all of them. I didn't get to Deerfield and Marshall, but by and large, most districts, the board is at some point or has at some point voted on whether or not to reopen or stay virtual. I think Sun Prairie and Madison are the only larger districts that have completely handed over this decision-making to their executive. I personally think that the board should be voting, or at a minimum, we should think more about how we work as a team with Dr. Jenkins to collectively make decisions about how we run school. We're statutorily tasked with making sure that our schools are safe and also with providing a program of instruction. And to me, that says that we need to be accountable along with Dr. Jenkins for any decisions we make that impact those two things. So I would like us to do some thinking around how what the board's role is in making decisions about how we move forward with virtual learning versus in-person learning. If for no other reason, then I think it will force us to have open, transparent public conversations about the things that are on parents and staff and even students' minds as we move forward. So that's my 2 cents worth. We don't have to have a long conversation about it, but I wanted to put that out there. Thanks.
No, thank you, Chris, for bringing that. I just want to get a clarification. Is the perception that board members are not part of the conversations, that from you or other people think that we are not part of the conversations with administration? Just wanted to get some clarification on that.
It's partially from me. I do think that, the board has been minimally involved as a whole in conversations about reopening. We have been involved in a lot of good conversations about instruction during the pandemic, thanks to you and your leadership on this committee. But I feel like this is the first really strong conversation we've had about decisions about whether or not to reopen or stay virtual. And I'm really proud to be part of a board that has centered equity and the needs of our most vulnerable community members and students in that conversation. I've, looking through news articles from other boards in other parts of Dane County, I'm not seeing those conversations happen like they're happening in Madison. And I think that's awesome. And I think we're on a really good track to, respond. We have had community members write to us as well and say, why isn't the board making these decisions? It has come out in many of the emails we've received from the public. So I think there is a public perception that the board is not involved in decisions about reopening schools and that we have turned over those decisions to the superintendent. And not all of the community is happy with that decision. So
yeah, I definitely think that this is a point for us to bring in our retreat, and maybe this is a difference between both board officers and also committee leads, because I do feel very much a part of the conversation. I had a really, really early meeting with Dr. Jenkins today to go over all the points of tonight. We spoke right before I left. Lisa has access to I talk to Lisa in a weekly basis around what's happening. But I'm realizing that my experience is not being shared by you. So I think that's something that we may want to talk at the retreat. I see that Gloria had her hand up. Gloria, go ahead.
Yeah, thank you, Ananda. And Chris, since you're bringing this up, I really want to respond to it. And I mean, I think for a variety of reasons. We hired a very knowledgeable, experienced superintendent who I'm confident that he is doing his job, and we have to let him do his job. Just because other school districts are making decisions or the way they do their work, that does not mean Madison does their work. Specifically, when we talk on many instances, SROs, for example, we decided as a school district to take SROs. Wisconsin school boards across the country, across Wisconsin, still have SROs. For example, we have Dr. Jenkins has been engaged with board members individually, updating them on where he was heading, who he has been engaged with. And I still feel strongly that this is an executive decision. When we decided to close schools, it was an executive decision. And I'm concerned, I have also heard from other districts that it has become very political when school board elected officials got involved. This is not a political decision. We cannot get this decision political. This is an executive administrative decision based on science, based on what our school superintendent knows and understands, based on his experienced staff. The minute it gets to the school board level, it becomes very political. We will get advocacy emails from both sides of the issue. And that is not how we should make decisions. And I think that Dr. Jenkins did his due diligence in listening to public health, listening to our experts that we heard tonight. And he has been in contact with each and every one of us around this decision. And we did an open forum where we talked about this. We got feedback from our community on this issue. We've done a lot of engagement around this topic. Just because the decision does not lie in the responsibility of the school board does not mean we're not doing our jobs, and that Dr. Jenkins is not doing his job. And so I'm not saying that you're saying this, Chris, but we really have to recognize, based on the board retreats, based on our professional development, that there is oftentimes it's sometimes a close line, but there is things that our superintendent is responsible for, and there are things that our board is responsible for. And we have to maintain, particularly during these critical crisis times is for us to get blinded by that and change course and change the way we do business. That's when we get into trouble. And I don't believe that it is the best interest of our school district and our community that the board make a decision like this.
I just want to respond really quick to that, Gloria. I hope I made it clear enough that I actually feel that Dr. Jenkins and this board are doing a really good job. Dr. Jenkins, I very much value your leadership and how you've gone about making these decisions. And I'm not critiquing or questioning that at all. I just feel that the public would benefit from the open and public conversations that have to happen if the board is involved in this decision making. Right now, a lot of those conversations are happening behind closed doors where they're not available to the public. So that's the rationale behind my thinking.
But we did community engagement, significant community engagement.
If I can jump in, does anyone know offhand how many viewers the Facebook Live session had?
Enlighten us, Savian.
No, I think it was above 100 or 500. I think we're at 15 viewers on YouTube right now.
Yeah, I think what you are bringing, we're highlighting, Savian, at least what's coming up for me is that echo chambers around our Madison have perceptions about this board and this board's ability to lead, or what our board should be doing and not doing in multiple ways. I really wanted to stay focused on facts, and I really want to stay focused, Chris, on you feeling very much a part of this board, and you and everyone feeling a part of this board. So if there is an enhanced level of communication that needs to be happening from your colleagues or from administration, I think that's something for us to discuss. But I don't share those sentiments. I do think that people say a lot of things about us and our ability to lead. And I'm pretty sure that they say a lot of things about Dr. Jenkins' ability to lead, but I'm very confident about all of us. And I'm very confident with Dr. Jenkins' leadership and the team's leadership. And I don't feel excluded on decision-making, quite the contrary. And I think the lengthy meetings that we engage in is a proof to that. But wondering if anybody else wants to weigh into this. And okay, go ahead. Okay, Nikki and Schmidt.
And I'm not taking a side one way or another. I'm going to actually take both in a weird way. The statute, Chris is correct. The statute does give the board to decide whether or not to make the decision. Gloria is also correct that we put some of our power in the superintendent. Ali is also correct in a separate conversation I've been having that the public health decision is the most dang important thing we're discussing, because we don't want anyone dead and we want people in their schools. So I moved to table this before we all end up ripping each other apart.
I think we're far from that, Nikki.
Yes, but I know my temper well enough that I don't want to start anything that will turn into World War III.
Christina.
Yeah, I just wanted to say I appreciated your suggestion that we take this up at the board retreat as we're talking about ways of working and how we work as a team with Dr. Jenkins to make decisions, and how we proceed with that, because we are still figuring this out. I've always said that the decision to reopen schools would be 10 times, if not 20 times harder than the decision to close schools. And we are going to continue to have these discussions. And I think that our community will have more confidence in us if we are doing this together. And so I just look forward to whatever way that moves us forward for the good of our students and our families and our staff. So I look forward to talking about it again if we can do that on Saturday.
Thank you. So our next agenda item is to talk about the Faulk Renaming Citizens Ad Hoc Committee. And so unfortunate. And if you're watching, I'm really sorry. The committee members had to leave our meeting because we had so much engagement tonight. But Lisa is going to bring Carletra and Adam. It's good to see you, Adam. Good to see you, Carletra. So go ahead, Lisa.
Oh, thank you, Ananda. You are correct. Our committee member for Faulk renaming did have to leave because of the lateness of the hour, but Adam and Carletra are here to present the committee's recommendation for a final vote at the board meeting at the end of the month. And if there are any specific questions or follow-up for the committee member from Faulk, we can certainly forward that to her, but I know we're in good hands with Carletra and Adam this evening. So I'll hand it off to you.
All right, good evening, everyone. I would like to first start off by just thanking Yolanda for chairing the committee, as well as the community members that served and worked through this very important process. The committee began meeting in August and received a total of 5 completed proposals. And completed proposals were for Malele Chikasa Anana, Dolores Sims Green, William H. Nolan, and there were 2 proposals that were submitted for John R. Lewis. So following the board process, all proposals were scored using a rubric, and all public comments were reviewed and taken into consideration for the recommendation from the committee. And so I am going to turn it over to Adam, and he is going to let you know what the official recommendation is. Adam?
Thank you, Ms. Stanford. And thank you to the board and everyone present for your time within this important agenda tonight. Well, Ms. Stanford and I are the ones present. We represent the ongoing work of a citizens renaming committee, a school renaming committee, and the hundreds of students, family, staff, and community members closely following these efforts. When we began these discussions a few years ago, we reflected on 2 key ideas. One, that the name on our building does not and never will change the commitment of those inside our school to upholding our district's graduate vision and meeting the ongoing needs of our amazing, talented students. However, with that, we also reflected on the deep symbolism a school's name has in projecting the ideals being upheld within our school in the district. It matters, and it matters a lot. Through those reflections, we willingly decided to enter into a journey to explore a name better suited to our students, our school community, and the ideals that our school community seek to project today, those of diversity, unity, grace, and excellence. That journey has taken us to where we are today, where after nearly a year, we proudly stand before you, formally submitting the name of Miss Malele Chikasa Anana for renaming Faulk Elementary School. While summarizing the work and the discussion that went into this selection in a few sentences does not do justice to the deep level of consideration that went into these efforts, nor does it do justice to the many, many characteristics of Miss Malele that led to this selection. I know our Board of Education has read our proposal and the accompanying presentation in prior meetings. That link remains available in today's board agenda and notes. I and our school community are humbled by the attention this process has received and the time our community has taken to submit the names of Dolores Sims Green, John Lewis, and William Nolan for consideration. In the end, after considering the ideals of diversity, unity, grace, excellence, and our desire to honor the name of an individual with deep ties to our Madison community, this decision became very clear. Miss Malele's contribution to the city cannot be understated, as evidenced by her many accomplishments and honors. Her commitment to education and our school district was clear. Her tireless dedication to uplifting Black voices in our community can be seen in her life's work. Ms. Malele's commitment to anti-racism and all levels of our system mirror the work we seek to uphold each and every day in our school's efforts. The hundreds of individuals who signed on in support of this selection speaks volumes. Individuals and organizations that span our community, our education system at all levels, local government, nonprofits, service organizations, faith-based organizations, and business leaders, among others. The inclusion of Philip Faulk's own family in giving voice to this process has also been important to our team. In summary, the Citizens Renaming Committee, consisting of current and former school family members Sarah Hall, Erica Janish, Claire Segrist, Kara Jenkins, and community members Verona Morgan, Gloria Hawkins, Yvette Craig, Yolanda Shelton Morris, Gloria Ladson Billings, Vance Ashby, Theola Carter, and Richard Scott, proudly submits the recommendation that Philip Faulk Elementary be renamed as Malele Chikasa Anana Elementary. Speaking as principal, we would be proud to teach our students about who Miss Malele was and the many gifts she selflessly provided to our community. On behalf of our school community, our school renaming committee, and the citizens renaming committee, we ask for your unanimous vote on January 25th in approving the name of Malele Chikasa Anana as the new name for Faulk Elementary. Thank you.
Thank you so much, Adam. I appreciate the beautiful words, both about your school, the renewed commitment, and this important event of renaming the school, especially someone that has been so visible in our community and has done so much to so many people. So I really appreciate all your words. Really well said. Curious if any of my colleagues wanted to join in sharing a couple words, maybe brief. Ali?
I want to acknowledge that Malele Shanaka Anand was the first Black woman to serve on the school board, and that I and so many of us benefited from her leadership at a time when nothing like her leadership had ever been seen before. I also want to acknowledge her family and that she died this year, and that you know, she was a person who touched this entire community, and I've talked to a lot of people about what it means to have lost her. And she's a person that deserves to be honored and deserves to be remembered. And, you know, looking to that committee, Vance Ashby and Richard Scott are folks who changed my life through their work in education. And I want to acknowledge that as well. Adam, thank you so much for everything you said tonight and for how beautifully you said it. And Carletra, thank you as well for doing this work. It means so much to me and so much to our community and so much to our young people. Thank you.
Thank you. Dr. Jenkins, you have anything else to add?
I'd just like to say thank you again to the community for bringing this name forth. And Adam, I have to echo that you did a marvelous job tonight of articulating just the work there of the community and just the admiration. I was in Beloit, Wisconsin, you know, just looking up here and with great admiration for when I was down there teaching as an administrator. So her work goes beyond the city limits. It's throughout the state that we know this great lady. She has been a role model not only for women, but for men and for people, and specifically African-American. I don't think I've heard one thing from anyone other than high praises, and I appreciate what the committee has done. So thank you, Ananda, for calling on me to say that. And I just say this with great admiration for this person that I, for years, have looked up to.
Thank you. Sabian?
She touched the lives of so many Black and brown kids in Madison through Emoji Magazine and her tireless advocating for children in our city. And I think so many people owe a great deal of their success to her. And it means a lot that we are able to honor her legacy this way.
Absolutely. Thank you, Sabian. Well, thank you again, Adam. Oh, Nikki, go ahead. Oh.
I do not have the pleasure of meeting Miss Malele, but I know she paved the way for many Black and brown students. She also paved the way for women on this school board in this city. And for that, I'm proud to see her get the honor that she is definitely due. I'm very, very pleased and honored that Faulk will be renamed after such a deserving woman.
Thank you, Nikki. Thank you again, Adam, for your presence here, for your beautiful words, and congratulations to the school and to the Faulk community for the new name. That's beautiful. and good luck on really honoring her legacy as the Shikasananda Milele's name and recognition of her work. So thank you so much.
Thank you.
Lisa?
Thank you, Ananda, and thank you, Adam and Carletra, for that really wonderful tribute and the exciting time ahead for Faulk Elementary School moving forward. So our next agenda item is a discussion about the cycles of review document that will be up for approval at the full board meeting at the end of the month. Oriana and Andrew are going to walk us through this document, and the purpose tonight with this document is to provide a high-level cadence of each area that's summarized in the cycles of review. The areas include the cycles of evaluation for our major plans, our high-intensity partnerships, and our major data sets. We'll also walk through with all of you the Scaling What Works section of the document. As this is a high-level summary, the purpose tonight is not to go in depth around any specific plan or any specific high-intensity partnership or data set. This document simply, as we said, lays the cadence out, the scope and sequence out, we have learned over the past couple of years that perfect plans with a set number of years does not always turn out the way that it is supposed to. So we appreciate the conversation and want to be sure that we have a chance to provide this summary for you tonight. So Oriana, do you want to take it over?
All right, I was going to ask Melissa to screen share as well so people can see. We don't have a PowerPoint because it's a pretty straightforward document. So you've seen this document before, most of you. So every year we basically, as Lisa said, go over a cadence of what our typical metrics reporting is that supports our strategic framework, as well as our evaluations for our high intensity partnerships and for our major plans. So with that, we can go to page 2, gives an overview of our data reporting. And so essentially our data reporting, as you may be aware, when we're in 2020, 2021 this year, we're typically looking at the reporting of metrics from the 1920 school year. As you know, a lot of our testing, our assessments, and our climate surveys that we usually rely on for multiple metrics for our goal 2 around climate are not available because of what, of having to close schools and go to virtual last year. So we will have limited data availability for some of these reports, and we're doing our best to put together data to support all of the reporting. But these also are annual reports that in theory over time, because they're snapshots, we have a good sense of where these students are at in terms of some of the reporting and trends. And we're looking at this data in other ways as well. And in terms of our annual report, also covered a lot of this information. So if we scroll down, this actually gives us a sense of our typical time frame for reporting. And then it also tells a little bit about what data we can anticipate for this year. And then if we go to page 3, we see the evaluation of major plans, and there's a chart on page 4. We can go ahead to that chart. So our major plans, we evaluate each of our 5 major plans, and those evaluations, for 3 of our major plans, we do external evaluations, and these are on a 5-year review cycle. So that's our English language learner plan, advanced learner plan, and our special education plan. So then if we scroll down just a little bit more, we can see where we do the internal evaluations for our behavior education plan and our Ignite plan. So that gives you a sense of the cadence. This year, because of everything that we're having to respond to, and as you are well aware through Andrew's involvement in reporting on all of our virtual learning surveys, of getting a pulse of what the community wants to see in terms of reopening metrics, all of those surveys, all of the research and support for those pieces our office, the Research and Program Evaluation Office, obviously is also supporting, as well as people trying to look at real-time data from some of our surveys on virtual learning, so we can react to that and make adjustments. So really our continuous improvement is really focused on how we've had to shift this year and how we respond to that in a proactive way. So what we have recommended here is to have primarily monitoring for this year and then go back to evaluations the following year. So we're basically moving forward with each year, but still having robust monitoring for this year. So we have monitoring reports, and those reports will be more robust this year to make sure that we're understanding and looking at each of these plans. And then we can scroll down as well to, let's see, the high intensity partnerships. There's also a chart for that. We scroll down a little bit more to page 6. Okay. The other piece is obviously we are lacking our typical data resources for, like, as I mentioned before, for end of the year testing. And then some of our ways of taking attendance and trends is difficult for us to see in terms of some of the adjustments that happened at the end of last year. So we have for our high intensity partnerships, the partnerships for our 10 high intensity partnerships, they meet each year and they review the metrics for the year, and then they make adjustments accordingly. What we're recommending for 2020, 2021 is for us to not do formal reporting for this year, but knowing that each of these partnerships had a formal report from the previous year that was a monitoring report. And then one of our partnerships is in the process of doing their evaluation this year. And then moving those forward to the 2021-2022 school year. And then I'm working closely with Brianne on making sure that we have very robust monitoring as well and adjust that accordingly as we move forward, so we're not missing any information or opportunities for continuous improvement and adjustment. The other piece of that as well is that you should have received earlier a monitoring, some updates from each of the high intensity partnerships that talked about how they're adjusting for this year as well. And then if we scroll down to, there's the scaling what works piece. And I would say the other piece, sorry, about the high intensity partnerships is that those partnerships will all be on the same 5-year cycles as the major plans for evaluation, which allows more of a summative evaluation and time for the plans to actually implement so that we can see the actual changes down the line. And then it gives them an opportunity to really reflect and make adjustments accordingly. And that is going to be the same for high intensity partnerships. So some of them did move from a 3-year to a 5-year, except for 2 that have a federal grant cycle for 3 years. And then our process of piloting, validating, and scaling, if we scroll down just a little bit, right there, thank you. Essentially, any time that we're developing an idea, for example, we're piloting right now our COVID symptom tracker. Anytime we're trying to make major changes to any of our programs, this is our recommended process of going through, of making sure that we understand that we have a research base for our approach and evidence-based approaches, that we're developing those plans or those programs, that we're piloting those and learning from those pilots in terms of using continuous improvement and data to inform our decision-making, validating, and then scaling those up as well. So that's the process that the district uses as we move forward with any type of program or new implementation strategies. Okay, so we can take off, thank you, Melissa, screen share and see if we have any questions or if Andrew or Lisa had anything else to add.
No, I have nothing to add. I think the highlights of the changes are pretty straightforward this time. Thank you.
Thank you so much, Oriana, for sharing the highlights of this work. As someone that has has worked in the district before. I saw how the implementation of the cycles review came to fruition in previous administration, and how much it has changed, how much it has evolved from that to be something much more comprehensive, something that makes a lot more sense. And then I really appreciate this last year, you all really taking a look at it and saying like what parts of this needs to continue to be, and what are some of the things that needed to shift. And in particular for 2020 is the fact that we had a major life change. And so, and how quickly you are all adjusting all the things that were a priority to adjust, and including things like the review cycles. So my understanding that you all took a look at the evaluation cycles through the lenses of what's happening current, which is something that I really appreciate. Anything else before we open up for questions from my colleagues? Okay, so we'll do that in order as well. So Savian, Nikki, Christina Schmidt, Chris Caruzzi, and Gloria, and Ali.
Could you come back to me? Sorry.
Yes, no problem. Nikki, anything?
Pass. I don't have anything at this time.
Okay, no problem. Schmidt?
Yeah, thank you. I do have a couple of questions, and this topic I feel is extremely important as we look to guide the work of our district toward improved outcomes for students. And like you, Ananda, I've closely followed these cycles of review since they were first initiated 6 to 7 years ago, and have been involved in, watching the plan process, the implementation, the evaluation, and how that cycles back around. I guess what I'm thinking about when we look at these is a question about, I guess one of the challenges I've seen with this cycle of evaluation and review is it feels like a lot of times with the plans in specific, we're measuring how well we're doing the plan and not necessarily if it's working for students. And I think there's a paragraph in there that it explicitly explains that the two of them are purposefully disconnected. And I guess what I like us to take a step back and talk about is if that does need to be connected. And I guess looking at if it's further down the line tonight, but the evaluation that we're going to talk about with the community schools, it talks about the process part of the evaluation. You're evaluating how well you're doing the process, and then it talks about the student outcome part. And I'm wondering if you can sort of speak to that disconnect, and if, after the amount of time that we've already done this, if we need to revisit that.
Yeah, and I'm trying to find the exact language in here as well, like to make sure I'm speaking exactly to that point, because I don't want to.
Yeah. I mean, it says each of these resources focuses on the success of the plan, not on the student group referenced. And I understand that there's a lot of places over the year where we look at how well students are doing, but it feels like if it's disconnected from the plans we're implementing, we may be missing something. So that's, I'm just trying to think if we need to revisit that as a process.
It's a clarification, in that case, a clarification of terms. And certainly like this is a document that I know Andrew's been very involved in, he can speak to it as well, but that has been in our system, and then we're modifying as we go, and we're still like, trying to see how we make adjustments. That really, I think what they're trying to get at with that point is more of like a semantics of, we're trying to make sure that when we say the English language learner plan, that people aren't thinking that we're evaluating how English language learners are doing. And I understand to your point, well, the plan should then be connected to student outcomes and how well we are serving those students. And I think that that wasn't really the intent of that sentence. And I think that we would need to revisit that in terms of trying to clarify that if it's getting could potentially get misinterpreted as well. Because I think it's just clarifying that really an evaluation, like a program evaluation, is of a plan or a program, as opposed to trying to say how these, like, the student group is doing, if that makes sense. It's like, how well is the plan working for those students?
Yeah, I would say that we're all saying the same thing in slightly different ways. Yes, so you have a plan. What adjustments need to be made to that plan? You really do need to have a very close evaluation of the effectiveness of that plan. You can, of course, not then separate the outcomes of the students that are benefiting from the plan itself. So there are always the contextual considerations for how are students with IEPs doing in the plan that supports the students with IEPs. It's a natural connection. Another reason to have that language in there is that, and Chris, you mentioned it, there are many, many opportunities to look at outcomes for students that are designated ELL or students that have IEPs, for example. And then lastly, I think we always want to be very careful in a program evaluation environment to recognize a number of different factors will play out for the outcomes for students, regardless of student group and regardless of whether or not there's a plan. So it is a recognition on those three fronts that we would want to have some recognition that there may be successes or challenges, for example, among students that are advanced learners, that is not a function of the plan. And we don't want to look at the evaluation review cycle to be the only way to know that. So if there is a need for some clarification on the language, happy to revisit that.
Yeah, I think so. I just don't want to lose the students in the process. And I think sometimes we get so wrapped up in here's our plan, here's what we're implementing, and we miss, the ultimate goal of meeting the needs of students. I mean, hopefully not miss it, but do you know what I mean? It's a process and an outcome thing that should be joined together in some way. I'm also just a suggestion, if we can add a few things in here, and I know this is dealing with the specific plans, the 5 major plans that we have, but if we could add in things that we are responsible for at the federal and the state level and how those interplay with how they feed into how we write our plans, but things like ESSA, the ESSA plan, PI 25, our students at risk of not graduating, PI 26, our education for employment, and how all these pieces fit together to inform the work that these plans eventually inform in the schools. And then I don't know if this is the appropriate place, but Lisa and I have talked about this before, figuring out instructional design wise, how these plans that when you put it on paper all look like they're in silos, how instructionally they fit together at the school level to meet the needs of students, and so that staff can functionally put them together in the classroom environment. And then, sorry, last process-wise, I'm curious when the monitoring reports will come. I know that the last plan update came in February of 2019, which was a combination of the special ed, the ELL plan, and the advanced learner plan all together. And I don't see that on our agenda for this year. So when will we, I guess, get the reports, and when will we have a chance to discuss this and looking at, what this year of COVID has done to our plans and their implementation too?
So monitoring reports are scheduled for spring and summer. And I think once and I don't know as much, I mean, certainly Lisa can speak to like getting them on the actual calendars. But I think getting this approved, which is a little bit later in our typical school year for getting this approved, will help us get those on the calendars, but I'll let Lisa speak to that.
Thank you for the question, Chris. I do think that a written monitoring report is something that we want to do at the end of this year, because just so that we can all know, right, and talk about how, COVID has, and what we've been doing with virtual learning has really played out for these student groups. So, Andrew, I know we had talked, like Oriana had said, spring or summer, that those reports would be available for the board.
Are you done? You're done?
If other people have questions on the high intensity partnerships and piloting, I have some questions on that, but I'll let somebody else go forward for now.
Carusi?
Thanks, Ananda. So I want to echo, very briefly what Chris had to say. I think this is a really important document for the board. And often I think we don't embrace the importance of this document for how we work and what we do. I don't know if in this draft, but in future iterations of this document, I would really like to see the language more specifically address how the monitoring and the reporting lines up with board decision-making and board responsibility. So what Chris brought up about statutory requirements that we need to be on top of, how do we align our cycles of review with our statutory requirements? I would also, a big part of what this monitoring does is help us make better budget decisions. Dr. Jenkins has talked about the importance of, keeping what's working and letting go of what's not working, like really focusing on how we can be a great school district. And I believe that this monitoring process for both our own programs and reports and our partnerships is a very important part of that budget process that Dr. Jenkins has talked about. And I think this document could more explicitly talk about how our reviewing of both partnerships and programs aligns with our budget cycle so that we can use the data we're getting from this process to make better budgeting decisions and to make sure that we're targeting our resources where they're having the most impact for kids, which is the bottom line. Like, we need to spend our resources where we're going to do the most good for children. When it comes to the high intensity partnerships, I think in general, the shift to a 5-year review cycle makes sense. However, for new partnerships, I'm wondering if we want to keep it at 3 years just because they're new partnerships. And in some ways, an evaluation is an opportunity to revisit that partnership and talk about it. It's not necessarily like you're working or you're not working, but it's an opportunity to have a well-reviewed conversation about what's working and what could go better. Sort of like when you start a job, you get more performance reviews more frequently. So I'm wondering if in the first cycle of a new partnership, we want to go 3 years and then extend to 5 years after that. I know that could lead to some scheduling weirdness, but it might be the most productive in terms of the relationship we have with our partners. And when it comes to the scaling document, it's pretty clear in that the language is, I think, getting a little bit weary and could use some updating. One of the comments in there is that currently the way that ideas come to the board is through senior staff, the senior leadership team. And there is a comment in there that in future iterations of this plan, we might be ready to discuss other new ways to generate ideas. I feel like we need to start having that conversation about the next iteration of the plan. I think we have a lot of really great ideas that could emerge from the school level and from the staff level that we are not getting as a board and not hearing as a board because of this process where everything comes through senior staff. Likewise, I think Pathways provided a really good example of how not having that direct staff voice in making decisions about when and how to scale is not good for us. We have seen that we had staff talking to us about challenges they're seeing in their schools and their ideas for solutions to address those challenges that weren't coming out in the evaluation and the recommendations we were getting from senior leadership. So I actually feel like we need to revisit the scaling portion of this and think a lot more about a less top-down, more grassroots approach to innovation in this district, as well as to scaling. So those are my comments. And Oriana, thank you so much for your presentation.
Thank you, Chris. Gloria and Lee.
So yeah, I agree with Chris on really trying to figure out how we incorporate grassroots and innovation in this, in our scaling document. I don't know how we do that, but I would like to maybe explore, from your staff on, what that looks like for us. I mean, and really getting staff voice on this. I mean, I think particularly because, I mean, after COVID, things are going to change. Like things are going to be different. Like we think that this is like the it thing right now, but I mean, I think things are going to change drastically, and we're going to have to reimagine, re-envision, like, and just wondering, I just would urge the board and the school district to really think about and leave room for how do we scale to a whole different way in a very fast environment, right? I mean, I think, it's no longer going to be, the 5-year plan or the 3-year, right? We're going to have to, for some time here, we're going to have to adjust, and we're going to have to learn to figure out how to do this as a board, how to do this as a school district, and how to really do something, right? Plan something, do something, evaluate it, measure it. If it doesn't work, reimagine that. So I just would like to see that in somewhere in our document, whether it be here or somewhere else. I would just make that recommendation.
Gloria, Holly?
I have no questions at this time. I do want to caution our board because I think there's an element of conversation that is around kind of newer initiatives or newer partnerships, or how do we kind of build trust and develop. And I think it makes a lot of sense to want to keep our fingers on the pulse on what we're doing to improve our schools for students. But I think keeping our fingers on that pulse is a multifaceted idea. And I think that we can't assume because we've been doing something for a really long time that it works well for everybody. In fact, I think that's almost the exact opposite of how this is working out, right? It's the things that we have done historically and traditionally that have produced the results we are now trying to correct. And it's interesting to me that when we have this conversation, we often talked about scrutinizing the solutions or the approaches to change versus the traditions of exclusion and discrimination that have gotten us to where we are today, that have necessitated change. And so I hope that we can be mindful of that as we have this conversation. And I want to thank you all for your presentation and time this evening.
Really. I'm gonna respectfully disagree to a lot of what has been said, mostly because although I really appreciate and I see the value of a paper format, linear view of our partnerships and programs and evaluations and methodology around that, I do believe that those levels of accountabilities are extremely important. I don't think that gazing at them will give us different results. In fact, I almost guarantee you that it won't. I think that if you're looking for innovation, creativity, grassroots growth, development, this document is not what we should be focusing on. We should be focusing on human beings, on people, and on our children and our teachers. That's what we should be focusing on. I understand that there's a different of opinion, some of my colleagues, but I will say that I had a hint that I was into something before I left MMSD, and when I got to the department where we, to a degree that I can never describe, write up plans and proposals and ways for accountabilities and compliance, and still perform one of the worst states in the country. I am certain that looking at documents and worship them or finding ways to change the language or a paragraph or find ways to look at other ways to write that plan or begin to write the plan before we're supposed to be writing the plan, those are not gonna make us a better district. We've been trying for quite some time, both at the district level and at the state level, and we haven't been successful at either. So my recommendation to the district is quite contrary to some of the things that were shared. I'm looking to find ways to humanize the ways in which we look at all of this. And I'm looking at you, Andrew, because I know you and I have had this conversation before, and I know you are in that quest yourself as well, and trying to figure it out. How do we balance? What is that balance of accountability and having a linear document that tells our story and that informs people of what we're doing and how we're doing, but at the same time, really talks about the human experience and gives all of us an opportunity to grow and to learn from things that we no longer need and things that we no longer want to be, or we never wanted to be, but we continue to performing in such ways. I want to give an opportunity for anyone on the team to respond, and then Dr. Jenkins, if you don't mind closing us out. Nikki, did you have some final words?
Actually, I finally remembered what I wanted to say. I thought about it. I've talked to Chris in the past, Gomez Schmidt, on this. I've thought about the plans. I've debated the plans. I've wondered if the plans are monitoring what they're supposed to be monitoring. And I just listened to what Ananda said. And although I don't always agree with her on this one, I think she might be right. Honestly,
it means a lot.
Truth is truth. And pardon my language, but it's needed for the quote I'm about to say. There are 3 types of lies in this world, according to Mark Twain. Lies, damn lies, and statistics. You don't use statistics correctly, they will come back to bite you because they will measure the wrong thing at the wrong time. People will tell you more than a document can ever tell you because they'll show you the actual weakness. I'm not saying throw out the data, but these plans are some of the most complex documents that I'm not seeing doing a heck of a lot. And I don't like being as cynical as I am, but I've been on the board 4 years. And 4 years, it'll be 4 years in April. And I'm looking at this and I can't see it, how this is helping our students. I just can't.
Thank you, Nikki. Anyone on the team would like to add anything else? Yes, Lisa.
Thank you, Ananda. And I appreciate the comments from board members so that we as a team know how to move forward and make the best decisions for students. I just want to go back a little bit because, boy, I was here, starting to feel like the elder stateswoman around here. I was here 8 years ago, and we first embarked on the English language learner plan. And if any of you were around at that was when we wrote the policy for English language learners. We didn't have a policy before. And the plan codified what we were going to do and what actions we were going to take to serve students with that policy then in place. I actually agree that the connection around are the actions leading to the outcomes. Like there's something there that I think can be more explicit, and what are we monitoring? I do think there's something there there about that. So I appreciate that feedback. But if there's anything I've learned in this, the process of these 3 plans, is it's given us a common language. And in many cases, it's given them the policy. We did the advanced learning policy as well. And that plan for advanced learners really saw us through the work in the Office of Civil Rights when we put that agreement into place. I do think, Nikki, just thinking about some of your comments, boy, I agree with you. Sometimes it's hard when the cycle is short to actually get some energy under your feet and actually start to implement when you're turning around and evaluating again every 3 years. And it doesn't mean you can't adjust along the way. So I will say that, and believe me, I've been here, and seen this, and they're going to start to back up against each other next year, right? You're going to have the ELL plan
followed by the special ed plan, followed by an advanced learning plan. And I do think in each of those, the priority of hearing the voices of our children and our families, and also our staff. In terms of when we did the special ed plan, which is actually still not completely done because of what's been happening with the pandemic, we are in the midst of still finding out what's happening with our special ed assistants and our special ed teachers. So I do want to concur with the fact that those voices have to be at the table. And then I just pulled up from board docs, page 8 of scaling what works. And I know there is some pretty clear language in there about making sure we hear from the people that are closest to the work that we're doing. And I saw some language in there that, Andrew and Oriana, we can take a look at, but it does talk about, right, the importance of scaling or innovating for a need, for a gap that exists, and having ways to measure that to see if it has an impact on something that we need. So I do think on page 8, I feel like we have made as a district a pretty clear stance around hearing the voices and finding the spaces and places for that, and the community feedback all the way through. So I'll make a commitment with Oriana and Andrew to go back and be sure that that page 8 is really clear, and just make sure that that language is certainly true and addresses, Ananda, that the human side of the work, right? This is people and process. But we also have to keep track of it for outcomes. So I just wanted to add that much from the team.
And I'll simply add the human aspects, the grassroots, the innovation, the less top-down, all of that applies. Absolutely. We used to call it, and I don't know if we still refer to it as a step 0, creating your ideas and then making some determination of what you actually want to try piloting. And those good ideas have to come from somewhere. I believe in it so much. I've got a whole office dedicated to innovation. The Rocket team can generate all kinds of great ideas. Individuals on their own can create all kinds of ideas. As an organization, we're only going to get the results we want when we don't do what we've always done, but we do something new. So the idea here is to harvest those ideas, give them a clear path forward that lets you know that it is a well enough tested idea to grow and to grow the benefit and the impact of it. So it is certainly not intended to be any sort of gatekeeping process to say only good ideas can come through this thing. In fact, it's really only intended to be the largest of proposals we have moving forward. So no one on watching this or on this call should think that there's any sort of restriction around having to run their good idea through this process. This is a very rigorous process that only applies to those things that really are presented to the board that have the likelihood of becoming a district-wide application. So absolutely, we have to have those ideas. This can help grow them, just like it can help grow a new business idea or a new science. Yeah. Thank
you. Chris, direct and succinct.
Yes, we got our update and discussed the ELL plan evaluation in August 2019, and I was just wondering where that plan is now that it's been delayed a year. Where are we at with coming up with a new ELL or coming up with the new ELL plan?
So the board will receive the executive summary of the ELL external evaluation. And then we will take next year to actually write the plan. We were in the midst, Chris, of actually sharing the ELL evaluation with stakeholder groups. Sylvia had just gotten that back January last year, and then we went into virtual instruction, as you know, in March. So, we learned from the first one that we did. And one of the things that I learned was that you can't write a new plan without sharing the evaluation and getting feedback from families and children who will be receiving services of that plan. So that was where we were at. So given the change in leadership that is upcoming in OMGE and curriculum and instruction, the board can expect to have an executive summary of the evaluation And then we'll take next year to actually share that out in the community before we actually write a formal plan. We missed that step the first round, and we learned from that. So we want to be sure that we're paying attention to that.
Thank you. That makes really good sense, and I appreciate the update.
Lisa, Dr. Jenkins?
Yes, I'm glad we're having this discussion. I think we need to really put it in our board development discussion, because this highlighted a lot of things that we need to really be working on to grow together as a team. This is a pretty serious discussion for me, having coming in and observing. I've seen many cycles of review, and we're discussing this deeply about going back almost to the things that we did 8 years ago to try to take us through COVID and come out better on the other side. Well, 8 years ago, each year leading up to now, how did it work for us? That's the only thing I ask you. How did it work? Really? So how, not to document, but how have we changed? What lessons have we learned through this? And even down to looking for data for anything that happened right at COVID-19, you're not going to get it. Nowhere in the country. And even the data that we were getting, we have to think about how we go about reassessing it. So I do too agree with making sure that we don't do things just top down. I mean, from the board level to the superintendent level, it can't be top down. We have to rethink how we engage people for real, and not just our teachers and principals. What about our parents? They've been missing, our students, that voice. And we've got to rethink right now how we're going to do business. Because to go back to these same practices, we're going to get the same results. Our results across the country, our results, let's get specific, for MMSD were not great prior to COVID. Now we have all this social emotional, a lot of other things going on, and we're going to go back to the same thing we were doing. No, we're setting ourselves up for failure. So let's start rethinking beyond just a cycle of review, but how do we engage people authentically? This is why I'm asking for a curriculum audit to see where we are with various things. And Lisa and I have had this discussion. I've shared it with all the board members. And I'm asking also for an equity audit. Because if we go back to what we were doing and don't take a deep review of doing position analysis and making sure that what we're doing, we don't rethink it, then we're going to wind up in the same place. So that's kind of where I am. But I think this discussion we're having now, we have to have this in board development, because I agree, this is a serious discussion. But I also agree, we can't think top down from the board to the classroom. Yes, you have some responsibilities, but that's not your role day to day. But we also just can't have the superintendent involved in just making rules and everybody follow it. And we can't have just the teachers. This is why we're doing the collaborative problem solving training as we move forward. And the MTI and I, Dr. McGregory, and the whole team, we're rolling it out, and we need to do the collaborative problem solving where we get all voices in beyond just what's in the schools. We have to bring our community into our schools and put our schools into our community. That's the new model that's going to help everybody come up out of COVID-19, not the traditional way that we've been doing business. So thank you.
Very, very wise words, Dr. Jenkins. Thank you so much. We're going to do a 90 seconds stand up break and breathe and turn off your camera for 90 seconds and then come back. Thank you, everyone. Along with Dr. Jenkins' words, one of the things that we're not going to continue to do is have 1 2-hour meetings sitting and not moving, at least not if I can help. So we're on to our last item in our agenda, talking about family engagement and community schools. Thank you, Angela, for waiting for this long to present to us. And I know I had invited a few guests, but I don't know. Thank you, Nichelle, for waiting. I don't know if they are still here. So Lisa, I'll turn it to you to invite your team.
Sure. Thank you, Ananda. We have a stellar team tonight here with us to share with you what the district has been doing to connect with families during virtual learning. And then we'll also be providing an update to you on community schools. The community schools update is informational tonight. I think you will hear tonight some actions that were taken to engage families, actions at the district level and also at the school level. So I'm going to hand this off to Nichelle, our Executive Director of Equity Engagement, and she is going to introduce the rest of the team.
Great. Thank you so much, Lisa. So for the first few slides, I'm going to really share this portion of the presentation with Angela Fitzgerald Ward, who's our Director of Family, Youth, and Community Engagement. And then we really are just trying to set the stage on some of the things that we've been learning and trying to do to engage families. And then we'll move right into community schools, which we believe give another amazing example of how we are, to Dr. Jenkins' point, bringing community into schools and schools into the community. And during the community schools part of the presentation, you're going to hear from Erin Peterson, our community schools manager, Carletra Stanford, chief of elementary schools. We have Dr. Annalee Good, who's with UW-Madison, Wisconsin Center for Education Research, and of course, our amazing community school resource coordinators who may still be with us tonight. So is Barb or Melissa doing the slides?
Melissa's doing it. I'll do it right now for you.
All right, thanks, Melissa.
You're welcome.
All right, we can go to the next slide. All right, thank you. So one of the things, obviously, as we reopen this year virtually, is we really had to ask ourselves, what does it mean to engage families in a virtual world of schooling? And even more importantly, how are we going to do that during a pandemic? We wanted to still hold a high level of belief and expectations that our families want to be involved, are going to be involved, and want to still see their children being educated to a high level. But we also knew that in COVID, because families are situated very differently, and we have very different impacts on folks, that we were going to have to find more nuanced ways to connect with families. And so this slide is really just to say that we wanted to focus on 3 basic things across our district. One, how are we going to share information? And even in your opening presentation with the medical experts tonight, right? Like we heard about, like, how does the public generally know? How do our families know? And that's true for effects of COVID-19, but also about virtual learning. And so we really wanted to focus on what are going to be the systems to share important information and really increase our communication strategies. We also know that it's always important, where we can, to provide as many opportunities for two-way communication. So that might mean, in this case, picking up the phone and going back to old school. It might mean really thinking intentionally about ways that we can foster that two-way communication with our families. And then that last point is because of COVID-19, because of the way that we're all living and operating very sometimes socially isolated or physically distanced, it was also going to be important for us to really get clear about how we could target our resources and support for families, and getting very clear about who we were reaching and who we were not. All right, next slide. And I'm going to hand it over to Angela. So that was just kind of at a big level.
Thank you for that, Nichelle, and good evening, everyone. During virtual learning, we executed a multi-pronged approach across many departments within central office and schools to build relationships with families. We also had to make some adjustments each quarter in response to family needs. So what you see bulleted are just some of the things that took place, including some outreach since last March and other adjustments that have been made throughout the year. So just very briefly, the CARES framework was launched during Welcome Back Week to provide guidance to school-based and central office staff on best practices for promoting equity and family and community partnerships. Guidance was also provided to schools to help streamline and improve communication from Google Classrooms for students and families. We've expanded what qualifies as metrics of attendance and have used that information as a basis to engage in two-way communication with families. Our research and evaluation team, shout out to Andrew and Oriana, released a pulse survey during the first quarter to assess family needs and to inform adjustments for quarter two. Some of those changes include revised Wednesday expectations so that staff had more time to engage with families, increased support for all families during virtual learning, and specifically for families of students with disabilities. Since March, the Family, Youth, and Community Engagement team and communications have hosted 15 Facebook Live sessions for families in English and Spanish on topics related to virtual learning and general family support during COVID. These events garnered a total of 55,000 views. And lastly, the Virtual Learning Resources Hub was launched to help families understand the expectations and requirements for virtual learning. The Communications Department is also currently launching a mobile app to better facilitate connections with families. Next slide, please. Okay. Several articles exist out in the field that speak to best practices to engage families during the pandemic and during virtual learning. These examples that are listed incorporate ways to make family engagement stronger and were implemented by schools and central office. They include hosting Zoom parent meetings to bring information and games and prizes together to draw families in. We've used our food distribution sites as another way to connect with families and to provide them with information. More schools have focused on connecting families to critical essential services. The work of staff like our social workers, community organizations, and our parent-teacher organizations have been doing to ensure that families have basic needs and essential services has been powerful. And we also have seen schools understand how socially isolating the pandemic has been and hold affinity spaces for parents. We believe we're working more on family engagement across our school system more than ever before because the pandemic and virtual learning has created the reality that we must partner with families. Some of these same examples of strong family engagement have definitely been done at our 4 community schools. I'll hand it back over to Nichelle for more details.
Okay, thanks, Angela. Next slide, Melissa. All right, so that kind of just set the larger stage about all the different ways that we've all been learning and adjusting and really working hard across the district and definitely in our school level around family engagement. And certainly it's a work in progress, and we are still striving to reach and connect with many of our families, especially those who have not connected with the district and us through kind of mainstream ways. And I think what we are going to hear next in our community schools update is some really great work that the community schools have been doing, their staff, their schools, to not only connect with families, but also to leverage resources which are better serving our students and our families. And I have to say that again, with this reopening and the pandemic, one of the questions that I think community schools has really wrestled with this year is, how are you a hub of a neighborhood when you can't bring people together the way that you've been accustomed to? Are you still a community school? And through all of the things that the staff have had to work through, I think what you're going to hear in these next few slides is that the kind of work, the kind of engagement, the kind of connections that are still occurring, are still embodying all the key features and functions of a community school. All right, so let's move into that. Next slide, Melissa. Just as a reminder for those of you who have watched our journey, we started with a selection process in 2015-16 because of an initial seed grant from the Madison Community Foundation, and that allowed us to actually move into our first cohort of schools, Leopold and Mendota, implementing in 16-17. We spent that next school year refining our implementation, really looking at our annual evaluation, thinking about how we were going to move forward. And in that 17-18 school year, just as a reminder, that was the same year that in May of that year, the Madison Community Foundation came back again with the Together We Thrive Challenge grant awarded to the Foundation for Madison's Public Schools, really to support expansion and sustainability of community schools. We then implemented our second cohort in 2018-19. And last year, when we came back to you in the 19-20 school year, we were really focused on the very conversation you just had on the cycles of review, whether or not we had evidence to validate the model. And then COVID hit in March. And so literally since March of last year, we've still been refining our data collection, the evidence that we can bring forward. And as we have come into this school year, the one thing I'd like to just point out is that we are excited about our general oversight of community schools now being included under our Chief of Elementary Schools, which we believe brings a strong instructional focus to the model. All right, next slide. Again, just as a snapshot reminder, you know the four schools: Mendota, Leopold, Hawthorne, and Lakeview. And this just gives you a snapshot of the diversity of students those schools are serving, the way that the schools are situated in their particular neighborhoods. And we also included how many students are enrolled and the number of staff in each of those schools. Next slide. All right, I'm gonna hang here for just a minute, Melissa. So when we came to you last January, it was almost a year ago actually, for our last community schools update, we shared with you that we were working really hard on what we considered the validation stage of the model. And your feedback to us a year ago was that we needed to continue to look at the kind of unique situation of each school, do a better job of finding indicators that would talk about the impact at the school level. And you really charged us to stay focused on equity. And so this team that you're going to hear from next, including Aaron and the resource coordinators, have been really hard at work refining ways that we're looking at what we would call our leading indicators, as well as getting more and more refined about the lagging indicators that we would expect coming through the impact of this model. At this point, I would love to hand it over to Dr. Annalee Good, who again is with us from UW-Madison, the Wisconsin Center for Education Research. And we have been really fortunate to have Annalee Good and her team working with us since the very first year we've implemented community schools. So she has a nice perspective on our implementation over time. All right, Annalee.
Great. Thank you so much, Michelle. I really appreciate having this space and being a part of the team. It's one of the most, I think, exciting and interesting projects that we have of some of the others that we work with the district. I want to also thank some of the other folks who are on our team.
from WCER. Many of you know Gwen Baxley, who was part of the original team, Yasmin Escucia Rodriguez, and Tyler Hook. So if you can do the slide, please, that'd be great. Thank you. So when we talk about building an evidence base, I'm going to talk real briefly around how we think about building an evidence base behind community schools. We think about evidence coming from lots of different places. So we talked a lot in earlier parts of this agenda about monitoring. So monitoring is one way that an organization can build up an evidence base. Research. So the research base behind a model is a really important way of understanding what evidence supports an actual model. And then evaluation. And evaluation, the difference between research and evaluation, there are lots of, obviously, if you think about the Venn diagram between the two, lots of similarities. But one of the differences can be that an evaluation and program evaluation generates an evidence base that is specific to a local context. So in our case, what does the community schools model look like in practice in MMSD? So I'm going to talk briefly about the research base and the research evidence behind the model itself, the 4 pillars behind community schools, and then set up us to talk about the program evaluation approach. So the research base is growing and is each year becomes more and more robust. But in general, and what you see on this slide is just some really high level summaries of the type of findings that come out of the research base behind community schools. So the overall trend with that is that it changes the ways and the processes within a school, and it changes it towards greater community voice and choice. And that comes through lots of different ways in the way the actual decisions are made, in the actual norms in a building, who has expertise, who's considered experts again in their own learning and in the own space. And then the very specific focus on creating connections, not only social networking connections, but also literally resource and partnerships connections. So we'll talk about that because that's a really important one of the leading indicators that Nichelle referenced. And then academic improvement. And I think this is important. There's actually a somewhat recent report or a summary that came out, a number of different researchers, ed researchers, pulled together the evidence behind community schools, specifically in the context of ESSA. And I think it's important to note that that summary suggested that community schools is an evidence-based improvement strategy under ESSA, which has very particular requirements for what's counted as an evidence-based improvement strategy, not only for targeted, but also for comprehensive plans. So I think that's important because it lays a foundation that the model and the model of the 4 pillars, again, which Erin is going to talk more about in a minute, the model itself has a large research base, a large evidence base underneath it. From an evaluation standpoint, so what does the evidence look like specific to MMSD? So we approach program evaluation, and just to clarify, our partnership is supporting evaluation of community schools with the district and with our PEO, with the FICE department, with all of the school level partners. So we are a partner. We do some of the evaluation work, not all. This is all part of a large partnership. So we approach it through a culturally responsive evaluation lens. That means that we center culture not only in understanding our own cultural identities and how we see evidence, how we think about evidence, how we approach evaluation, but also thinking about the cultural context in which we work, and that informs the questions we ask, that informs how we interpret the data, who interprets the data, who gets to make meaning of the data, and that's a very much a looping cyclical process to engage the community itself in interpreting the data that's coming out of the evaluation work. It's also responsive to context. And my goodness, the first 3 hours of the meeting, talking about the importance of the context of COVID in what this means in schools and how we understand then building an evidence base around what is happening in schools. And so we are trying to be responsive to that in the design of the evaluation itself. I will say, and we also support, our team supports the community schools initiative in Milwaukee Public Schools. So I can say with some experience, this is hard. This is very hard work. This is very complex to understand how to create measures of something like community schools, which is a school-wide model, in a way that you can say with confidence is evidence. And I really appreciate the long view that the district has taken to building that evidence base over time and being patient, having the patience that you need in order to do it right and to do it in a valid way. Slide, please. Thank you. So when we look at evaluation, when we're structuring the evaluation of the Community Schools Initiative, we focused in the first couple of years very much on implementation, looking at the process of implementation, and that typically looks at resources, activities, and outputs, if you think about a logic model. We also then are looking at leading indicators and lagging indicators. And so leading indicators measures those initial changes that we hope to see, primarily outputs and short-term outcomes. These are then prerequisites, and the research base suggests this, that when we see changes in those leading out indicators, we're going to see changes in the lagging indicators. And the lagging indicators tend to be more the long-term outcomes. So we organize understanding the leading indicators by the 4 pillars of community schools, because that is showing alignment to the model itself. And it helps us to understand how it connects to the larger research base as well. Okay, slide, please. So I'm going to turn it over to Aaron, who's going to talk more about the 4 pillars and some of the patterns that we're seeing in the leading indicators.
Thank you, Annalee. Good evening, everybody. So to begin, I would like to take just a brief reminder that these we've been drawing from the evolution of research in the field coming from the National Community Schools Coalition, the NEA, and the Learning Policy Institute around the pillars of community schools. And all of this research really boils down to these 4 pillars being essential to the work. So as you can see, starting from your left, you have integrated student supports, which is largely focused on mental and physical health. You have expanded and enriched learning time and opportunities, which has a focus on after-school programs, weekend and summer programs that provide academic instruction and individualized supports. Family and community engagement, which promotes or focuses on promoting interaction among families, administration, and teachers to help families become more involved in the decisions about their children's education. And this pillar really elevates much of what Nichelle was alluding to a little while ago, especially during COVID. How are you a community school when you're not in school? And so this family and communication really highlights and elevates schools functioning as a neighborhood hub. And the last of the 4 pillars is collaborative leadership and practice, which focuses on parents, students, teachers, and principals, along with community partners, building a culture of professional learning, collective trust, and shared responsibility, using strategies such as site-based leadership teams, teacher learning communities, and others. And so we look to these 4 pillars as our ways of measuring our collective impact on the leading indicators that Annalee was just speaking of. So we'll go on to the next slide, please. So this slide is a high-level self-assessment that was done by our resource coordinators around their progress on the implementation of the 4 pillars to date in each of their individual buildings. We use the scale ranging from emerging, developing, and proficient. So emerging, which no schools have identified themselves as being in this stage, which would be very beginner or having things just in progress, things like that. Developing is orange and proficient is green. In assessing our progress, we considered if the school has been able to sustain activities in that pillar across time, whether they felt that they have data as evidence to validate success in that pillar, and whether or not they've been able to address root causes that they've identified through their needs assessment that they've conducted with their community school committee, which consists of students, teachers, community partners, and community members. And so the difference between orange and green really is where schools are in relation to the considerations that I just shared. So as you'll see, that Lakeview, for example, has indicated that they're green or proficient in integrated student supports. This is one of the areas that they've really centered and focused their attention on, because they've done a very robust needs assessment with their community. And social emotional learning and supports is something that they've been able to identify as a significant need, not only of the school, but of their local community. And so they've been able to focus many of the resources and learning opportunities and internal structures and supports around social emotional learning, to the point where they have sustainable programs and they have evidence to support that they are seeing impact in integrated student supports. Similarly, Mendota is proficient in family engagement because they've had a long and strong history of family engagement built on trust with families and community partners, which has been identified by them as a root cause through their needs assessment. And so those relationships have been sustained through the pandemic and virtual learning. And they, again, feel like they have the necessary pieces in place and the evidence to show that they're in a place where they're seeing gains and positive benefits within that pillar. So the good news is that in all cases, the schools are actively developing in each of the pillars and doing a lot of great work in implementing each one of these pillars. So we're really seeing some great work coming, and we're using these measures as indicators of success. And I think we're really seeing some things that are strong. And much like Ananda opened with tonight, and the larger discussion that we've heard tonight around COVID, that has also had, we feel like, a significant impact on not seeing as much green as we'd like, because we've had to shift away from the programs, the processes, and the structures that were in place pre-COVID, to really shifting it and focusing on family supports, and have slowed some of the work that's been done in these pillars prior. Next slide, please. So I'd like to just take a moment to introduce and reintroduce the resource coordinators to you all, and I'm going to have them actually introduce themselves and share one highlight of the work that they've been doing thus far this year. So we'll open up with, well, let's see, I don't know who's still on, so I won't call anybody out. I'll just let them jump in based upon who's here and who would like to go first.
I'll take one for the team.
Thank you, Rosie.
Good night, everyone. My name is Rosalia Gittens. I go by Rosie. I'm the Community School Resource Coordinator at Leopold Elementary. And I think one of the highlights in my time at Leopold has been the collaborative nature of our stakeholders. I think we have come a long way as far as learning to or improving in working together, not only among staff, but with our families and with our partners and community members that are willing to help and support us. I think we have working groups now, instead of just kind of like everything relying on one person or one group in a specific. It feels a lot more like a shared leadership, and we come together in different groups and brainstorm different ideas, and then put it into place and kind of have action-oriented ideas. And by no means is perfect. It's not perfect. That's why we are still in the orange, right? We're still working, but it feels good. It feels good to have an idea and have people support it, and have people who are have different talents and different ways of working, and just making it work. Thank you.
Thank you. Any of our other coordinators still here with us?
Good evening. My name is Erica. I'm at Hawthorne Elementary School, third year there as a coordinator, 11th year at Hawthorne. First, I would like to say for the principal, Beth Lehman is on here also. Shout out to Prince. First, I would like to say that Hawthorne has really put together the SIP, our school improvement plan, aligned with our community school coordination plan. This process is usually you see this within the 4th or 5th year within the community school model. We was able to do that in year 2. We wrapped that up last year. So I'm really, like you said, Rosie, the shared leadership is there, and it is seen throughout Hawthorne. Everyone, there's no buy-in with community schools. So I'm really proud of that. I'm also proud of our continued work of our anti-racist work within the school and the district. before saying a lot of before before break, we had all 4 community schools come together for a PD that was led by Dr. Terrence Green, and how we teach our Black kids and our kids of color, and what that means in our site, and how that transfer out into our community and what that looks like. So that was very exciting. Thank you.
Thank you, Erica.
Melissa, is there more slides?
Yeah,
Oh, hi, Sonia.
There are more slides, yes. We got Rachel and Sonia.
I'm wondering, Melissa, can you take off the screen just so everybody can see everybody? Thank you. Hi, Sonia.
Hi, everybody. I can go next. Hi, everyone. I'm Sonia Spencer, Community School Resource Coordinator at Mendota Elementary. Very proud to say that I've been a part of the Mendota community for almost 9 years, and just really honored to be working in our community and with our families. And I can definitely say that, you know, we've navigated some uncertain times these last couple of months. We've had to figure out, you know, what was going to work best for our community, which meant, you know, approaching our communication and our outreach in a holistic way, and having honest and open communication with both our families, our staff, and the overall community that supports us. We've been able to respond to immediate needs to support our we've been able to respond to immediate needs for our families with the support from our school partners in the areas of connectivity to meals, to supporting families with the rent and utility bills. And pretty much that being said, we really focused on, our focus has always been family engagement, but we took a stronger initiative and we really focused on community engagement. It became a focal point for us by putting families first and meeting them where they are. And I know I said it earlier, but I'm just really honored and I'm proud to be working with a team that is passionate, dedicated, and really has the heart to keep moving us forward despite of these, you know, unprecedented times that we have faced. We honestly could not do this work without the support of our team, our school staff, our principal, our community partners, our school partners, really just the North Side at large. And of course, you know, the support of MMSD and the Family Engagement Department backing us up. So it's been a long couple of months, but we're really proud of what we've been able to accomplish and the relationships that we keep sustaining with our families and our scholars.
Thank you, Sonia. Rachel, are you still with us?
I am, yeah.
Awesome.
I'm trying to put my video on, but it's telling me I can't. So you can just look at my face in my photo. So I'm Rachel. I'm the resource coordinator at Lakeview, also on the north side of Madison. And I have worked at Lakeview for about 9 years. This is my 3rd year in this role. And I also went to elementary school at Lakeview as a student. So I have that long connection with the school. One recent highlight, this week we're actually prepared to finalize our process of giving out about $20,000 in FEMA emergency funds to support eviction prevention. And this is kind of a new area within the COVID era that we have been focusing on, knowing that many of our families are struggling with income loss or job changes and, you know, are really feeling that pressure to maintain stable housing. And we feel very proud that we've been able to seek out grants and partner with local nonprofits to be able to disperse funds to families to help them out with bills during really stressful time. So that's one thing that we're looking forward to this week, to push out that funding before the federal eviction moratorium is set to end at the end of this month.
Thank you so much, Rachel. I appreciate that. And yeah, another shout out to Principal Lehman for making it through with us, sticking with us. Thanks for joining. appreciate you being here and supporting us through this. And thank you guys for your great introductions and some of the highlights of the amazing work that you guys are doing during COVID. And I think that is some of the stories and work that they shared is a great transition to the next slide, which Anna Lee will walk us through. And she'll be talking a little bit about the resource mapping process that the evaluation has produced for community schools. So Anna Lee, I'll turn it back over to you.
Thank you, Aaron, and thank you to the resource coordinators for on so many different levels for everything that you do. We're trying to think about ways that we could better capture and illustrate the work of community schools, and if the role of the community school coordinator and the resource coordinator is coordinating resources in all the different ways that you just heard, and a million more. Is from an evaluation standpoint, how do we capture that? And as I said earlier, it's complex, it's hard, and we want to do it in a way that is meaningful not only to the district, but meaningful to the community, meaningful to the school level staff, meaningful to youth. So we started a process earlier last year, before COVID, to think about a resource mapping project. We also started a photo voice project too, to try to gather youth voice in thinking about what are the impacts of community schools, but obviously COVID put a stop to that, at least for now. But the resource mapping and the partnership mapping was a way that we could capture some of the very nuanced, complex work that the resource coordinators do to make connections. So what you see here is one of 3 different views of a map that we generated using some mapping software that came out of a data set that the resource coordinators and Aaron and others helped to populate. And so we had lots of really interesting conversations around what is a partner, what is a partnership, what do we want to know about the partnerships, how do we organize them? So what you see here, and I know it's small, it is linked into the report that you got, and there's all three views are linked into the report as well. But what you see here is at the very top is a node, and that's the school district. And then there are 4 nodes then around the bottom, which are each of the 4 community schools. And then there are the partnerships coming out of them. And so you start to see connections between community partners that have multiple connections among community schools. And then it's color coded by the type of the area of focus. So is it funding? Is it volunteers? And this is the first run that we've done at this. And it's prompted some really interesting conversations with resource coordinators. And also hopefully part of it is providing a tool for also then talking at the school level committees about their work. And part of what we're trying to do with this as well is to create something that then we can look at over time. And we potentially are going to look historically back to see if we can create essentially a baseline map to show when you have a resource coordinator at a school, how many more threads and strands and connections happen because of the resource coordinator being there and building out and the community partnerships. This is one of many different ways we can try to understand how the community schools are doing in terms of leading indicators, but we're pretty excited about it, and I'm happy to answer questions too about what this is trying to represent later too. Thank you.
Thank you. Next slide, please. So this slide, as we've been kind of transitioning a little bit into the focus of community schools on how schools have reacted during COVID, we wanted to share a couple of the highlights around the school work along with the impact of COVID. So even though COVID has slowed some of the areas of work that I shared earlier, community schools have really been, and the coordinators have really been able to focus on building strong community relationships and support family needs. And again, this slide just gives you a very brief look at just a few of the amazing things that schools are able to do to respond to the family needs during this time or during this year. And so you'll see each school was able to leverage funds and partnerships to ensure families received assistance with things like food, rent, as Rachel pointed out, utilities, and educational supports. Each was able to raise significant amounts in grants that were used to support family needs. And so I just wanted to share just a couple of highlights from each school around kind of what they were able to do inside of the school or with school teams around supporting families in their community. So Hawthorne, starting with them, they created a student support team which used morning meeting partners to build stronger communities and assist in grade level based advisors to follow up on attendance and engagement. And then they created some virtual learning clubs to help students connect and have an outlet for creativity as they were dealing with many of the drawbacks of this pandemic. Lakeview, their student services team assigned a grade level person and a point person for higher needs families to follow up on attendance and resource connections at the school and in the community. Leopold's family support team created a mobile food pantry and has created some ongoing materials and supply distribution and drop-offs and done some really great work around supporting family needs there. And Mendota's family engagement committee shifted their food. They really established and deepened their work with their partners, including the Packers Community Learning Center, the Northside Planning Council, and Feed Kitchens. And with their partnership with them, they were able to deliver meals and support family meals at Ridgecrest, the Ridgecrest neighborhood and community. And they were also able to shift their food pantry, which was housed at Mendota, to the Packers Community Learning Center to better support family needs and provide deeper access for families to get their supports needed there. And they've also created, they've also focused on building truly authentic relationships with families with a specific call out to restorative justice work through the community schools model. And then with that, they've created training and professional development to support staff engagement strategies, do some data tracking of family surveys of their needs and wellness. So these just wanted to give you a really quick highlight of some of the amazing work that's been COVID specific that the coordinators and the community schools have really honed in on. And again, they've done some amazing work uplifting their families and supporting their families during this time. So we'll move on to the next slide, and I will turn it over to Carletra to talk about some of the instructional moves in the schools.
Good evening again, everyone. I am going to talk about one of the other leading indicators that we look at is how schools are making instructional moves and focusing on student learning, specifically in how they are sharing leadership with families, community, and staff. I want to highlight some of those areas that are listed here. And there's an intentional focus to integrate parent sessions and learning with student learning and many of the services and events that are held by community schools. So all of our community schools have engaged in the Madison Parent Teacher Teams, or MPTT, and those conferences differ from traditional parent-teacher conferences in that MPTT included an instructional component where parents worked with teachers and other parents around various instructional strategies. Our out-of-school time also prioritized academic opportunities for students, and some of our schools worked in partnership with MADAM and also CEOs of Tomorrow. Some of our community schools have engaged in the very important work of piloting district curriculum and working in partnership with the Achievement Network. In addition, schools held open schoolhouse nights in which students participated in various sessions that were inclusive of parent participation with their children, but there was also intentionality around including sessions and activities specifically geared towards providing resources and connecting parents with various school-based academic information and learning opportunities. So as Erica mentioned previously, another move by leaders was to ensure that school improvement plans were inclusive of the goals and priority areas of community schools. So some of these examples, of course, were prior to the pandemic, and some of them have happened during the pandemic. And while these are not universal strategies, these are examples of schools sharing leadership with parents and staff, and also focusing on the whole child as a learner. Next slide, please. One of the exciting things about community schools has been the influence that they have had on schools across the district, specifically with our elementary schools. A number of schools that are not officially designated as community schools, we actually started referring to them as like the Big C community schools, which were the official schools, and Little C community schools, which were those that were taking on some of the components of the community school model. So those strategies have been used by different schools, and specifically around lifting and prioritizing voice by engaging in empathy interviews with families and staff. And we also have a number of schools who have implemented various resource strategies to address parent and caregiver needs, such as the creation of food pantries and adult education opportunities. And additionally, all 4 of our community schools, as Erin mentioned previously, are engaging in restorative justice work. Next slide.
All right, this is back to me. So up until this point, you've heard a lot about the leading indicators and the promising work happening within our community schools and the implementation of the 4 pillars. We also recognize that the question about outcomes of change still arises. And so we wanted to come back to talk about the lagging indicators with you. In my role in the past year, I've worked a lot with Annalee and her team out of WCER and our district research and program evaluation department to hone in on data analysis. The presence of the leading indicators that were previously discussed should result in measurable long-term outcomes or lagging indicators that provide evidence of the impact of community schools. As suggested by the name, these outcomes are typically measured after a number of years have passed. For example, it's not uncommon for national evaluations of community schools to take place 5 years after implementation. The following data summarizes trends for math and reading proficiency rates and school climate survey results for community schools by cohort. These trends are presented as very simple comparisons with schools who had similar need scores on the 2017 needs analysis, but were not selected to become a community school at that time. These needs range from the demographic makeup of schools to their academic performance, attendance, and behavior rates. I do want to strongly emphasize, though, that this data is the first step towards a deeper comparative analysis, and additional steps need to be taken. We're not able to draw strong inferences at this time. Future analysis will also include other previously discussed lagging indicators, such as changes to behavior events and attendance. Next slide, please. Okay. The graphic shown here, and I know it's small, but hopefully you can open it up on your own, shows 7-year trend data for grades 3 through 5 on math proficiency rates in both math and reading. The shaded sections indicate years in which the schools in each cohort were community schools. Students in the first cohort maintained or increased their proficiency rates in math and reading during the first 3 years after transitioning into a community school. While a similar trend was witnessed with comparison schools relative to their math proficiency rates, they experienced a steeper decline in reading proficiency over time when compared to cohort 1 community schools. At the time of analysis, we didn't have enough trend data for cohort 1 schools, but given the outcomes for cohort 2 schools rather, but given the outcomes for cohort 1 schools, we're interested in seeing the trends that emerge for cohort 2. As a reminder, this is a basic comparison, and our research and evaluation team is interested in digging deeper into the comparison data and further analyzing MAP scores and other academic outcomes. One area for further analysis is movements towards proficiency or growth rates, for example. Given that these outcomes are lagging indicators, there's also interest in looking at 5-year and beyond trends. Next slide, please. Okay, so here we're looking at positivity rates on sense of belonging from climate surveys administered between the 2015 and 16 school year and the 2018 and 19 school year. The shaded sections again indicate years in which the schools in each cohort were designated as community schools. As you'll notice, there was an immediate 1-year bump for cohort 1 relative to students' sense of belonging. Parents' sense of belonging is also increasing. We need more data to identify cohort 2 trends, but their first year looks promising. When compared to the comparison schools, community schools have a lower baseline, but are trending more favorably. Further, community schools leverage some innovative practices during virtual learning, as previously discussed. And as a result, future data could provide evidence of maintaining or increasing belonging over time and in the midst of a pandemic. We can continue to look at these outcomes over time, as well as other lagging indicators of interest. So now I'm going to hand it back over to Nichelle to discuss the possibility of expansion.
Thank you, Angela. Next slide, please. All right, so we did attach the full summary report. We've heard from Dr. Annalee Good and her team's work, and they think that our evaluation around our implementation gives us the evidence that we have enough leading indicators to expand. One of the other things, though, that we look at with expansion, obviously, is what would be the cost and how do you do that and also sustain the schools that you have already designated community schools. So we are continuing to work through the budgeting and the projections with the Foundation for Madison's Public Schools to really ensure that we would have a sustainability model if we were to add more schools. I can tell you that we have looked at those projections on a couple of different scenarios, and sustainability looks pretty positive depending on how many schools we might potentially add in the future. And as you heard Aaron talk about leading indicators, Angela described some of our lagging indicators. We are committed to deeply exploring additional data and refining what we are looking at, particularly around the academic metrics for the model. All right, next slide.
So I am going to close us out here. When we look at the next steps for community schools, there are three main areas that we will explore and work on over the next several weeks. So as Nichelle mentioned, we have the recommendation from the UW-Wisconsin Center for Educational Research to expand the community school model. Again, during the next few weeks, we will work to create scenarios to take our recommendations through our annual budgeting process, senior leadership team, and cabinet for consideration. If we receive approval to expand, any new district funds will appear in the budget workbook. But again, we are not bringing forth a proposal for community school expansion at this time. And so in conclusion, I would also just like to take this opportunity to briefly, as we are transitioning community schools from Nichelle's department to the chief's department, to really thank her and the team for the tireless work that they have done with bringing and implementing community schools to the district. I have had the pleasure of being a principal of a community school and then also working with the other principals who have the community school model at their school. And so it is a very complex job, but very worthwhile in being able to bring in the resources and the partnerships from the community to be able to better serve our students and our families. And so just a really big shout out to, again, Nichelle and the team, as well as the principals, the community school resource coordinators, and the parent liaisons and the staff for all they are doing to ensure that this is a model that will benefit our students in the district. Thank you.
Thank you so much, Carletra. Thank you so much, Nichelle, Angela. It's good to see you, Annalie, again. And thank you so much all for the sharpness on the research. Thank you so much for the coordinators that stayed to when I thought it would be a good idea to have their voices and introductions. I didn't realize how late we were going to be. So thank you so much for staying with us late. Nichelle, do you have any other words before we turn in? And I'm wondering if Dr. Jenkins have anything else before we turn into my colleagues for questions.
I think, first of all, thank you as well for staying around for the presentation. Thank you, Dr. Good, as well, for that information. I think it was very important to what you shared with us. And I'm looking forward to hearing more about this as it's coming up the ranks. I have been trying to keep up with the community schools because I do believe there's a role for community schools, but I'm looking to hear more about what we're doing from Ms. Stanford. Thank you, Ms. Stanford, and Ms. Nichols for just shepherding this the way that you guys have. And I know that Ms. Nichols is definitely passionate about this particular piece. Thank you, guys.
Thank you, Dr. Jenkins. So we're gonna go Nikki, Chris, Savian, Gloria, and Ali, and Christina.
Pass.
Feruzi?
Yeah, thank you so much for the presentation. One question I have is, have we made any effort to look at the grants and other community support that are coming into our community schools and look at how MMSD investment in this model is leveraging additional support for our kids?
Annalee, do you want to, I'm not sure if you included grants or actual dollars being leveraged to Chris's point that are being leveraged, and if not, that's okay.
Sure. Yeah, that's a great question. So as Nichelle just suggested, there's kind of multiple layers to that question. One is just what types of partnerships are there because that community school structure is there and then the resource coordinator is able to leverage different grants. And that is represented in the maps that we did because we tried to identify which partnerships were around grant funding or other types. To the other point, Nichelle, you were making about the actual financial, the kind of return on investment type work. I know that that's ongoing. We have not. That takes a considerable amount of of time and work that has been done with community schools in other communities. So the research base does speak to that return on investment, but maybe others in MMSD want to speak to if there are efforts towards that.
I could try to speak briefly about the large grant that Miss Erica helped us receive at Hawthorne from United Way. Just to follow up the point of you are saying what is the ultimate impact to the children? I just think of Dr. Jenkins saying when we're talking about COVID, we can watch what we're doing super carefully or perish. And these grant funds helped people pay rent, put food on the table, and people survive during COVID so that kids could learn and be trying to engage in school. So they're huge in keeping connected to our families and engaged while meeting basic needs for the families. I don't know if that answers your question.
That's really helpful. I think it's a nice qualitative example of how we're leveraging additional support for families and kids, and that's great. So thanks.
I could also share a little bit more about some of the grant writing and fundraising that's done on the community school level. So if we're looking at kind of the last year in total, I think we have we're trying to track all the grants that are coming, and Lakeview is a standout school regarding grant writing and grant awards that they received. But I mean, including COVID and this last year alone, the 4 community schools have raised about $160,000 or received about $160,000 in grant funds to support various initiatives around COVID support, social emotional learning programs, instructional learning programs in school, things of that nature. So I think just kind of on a general level, it's not going to be quite that high every year, but through adoptive school partners, schools are receiving grants that are being targeted and specific to support programs that are highlighted or outlined in their coordination plan, and they're leveraging those grant funds to support the specific work that's been identified again tonight in the pillars. So much of that work is when they do write grants and they do receive those things, it's going specifically or targeted towards the initiatives.
Thank you so much, Aaron. Who did I say after Chris? Y'all changed on me.
It was me.
Okay, thank you, Sadie.
Yeah, I just want to, no questions, but I want to thank everybody on the team here for presenting. I'm looking forward to the budget presentation. I know that a lot of the strategies that community school employ our research base, especially to help meet the social and emotional needs for children, especially interested in how we will combine this community schools strategy with the all-day 4K pilots that will be at a few of these schools as well. And I can't thank y'all enough for meeting the needs of children in this innovative way, especially during these extraordinary times. So thank you.
Thank you, Savian. Who is next?
I'll go next.
Go ahead.
Okay. I have no questions, but I just want to thank you, everyone, for this work. I think that this is our future, and I'm just, I just wish we were moving faster. I understand why we're not, but this is it, right? I mean, this is the future, and like we have to really figure this out and get on board. I just I'm not that we're not on board. It's just I feel like since we you know, since I came on the board, we were having these conversations, and I almost feel like because it is our future, I feel a sense of urgency on it because based on everything that's happening right now, you know, we're going to have to move fast, right, when we are there. And I just don't want it to be too late. And I think that this is the time, I think the next, you know, few years, that this is going to be the time where we will need to invest in community schools. And so I just don't want, and I'm glad we're taking this time to really just perfect this work. But sometimes, you know, we just have to jump in and learn from our mistakes and just jump in and do it. And so I just can't wait to see the future because this is really going to be it. And we're going to have to invest within our budgets, within our school, building our school capacity around community schools. And so I'm really excited about this because we're going to be, whether we like it or not, we're going to be, this is the future of our schools. So thank you, Nichelle, Angela, everyone, Beth, everyone for this work. I mean, just your whole entire team, Sonia, Rosalia, Erica, Rachel. I mean, you guys are just doing amazing work. So thank you for all that you do.
Thank you.
Ali and Christina.
Thank you so much, Ananda, for facilitating this meeting for the last 5 hours. I'm like, you are a champion. I want to honor and recognize the work you all do with welcoming schools and the leadership of Nichelle Nichols. I also want to recognize everybody who spoke. I don't feel like we're at the point in the evening where I could do justice by the conversation that you all just so elegantly and energetically were able to deliver in these wee hours of the evening. However, I am so grateful for the work, and particularly the innovation around the work that is specific to this moment in terms of COVID-19 and what families really need. Thank you, and I think what you're doing for our community and our children and the families of our community is something I can be grateful for beyond measure, and absolutely have no ability to really speak to at this point in the evening. So hopefully it comes across. Thank you all, and yeah, Christina, hopefully you're going to end your comments with motion to adjourn.
I will.
You are all whips. You forgot. I'm 3 hours ahead.
I just want to
You're
say
a whips.
thank you so much for sticking with us this evening. Your presentation was so important, and even though it is late into the evening, I sincerely appreciate this really comprehensive look at what's happening for community schools and how the pieces are being put together. So the leading indicators, lagging indicators that resource mapping map, I'm super excited about, to see just how we can show that visually to people, what this means for our schools. And so just really sincere thanks for being with us here tonight. And I'm just looking forward to continuing the conversation. And with that, I'll make a motion to adjourn. I'm just kidding. I'll let Dr. Jenkins if he has anything, and Ananda.
Thank you. I'm still the facilitator here. I think Michelle has something else to say.
I just wanted to quickly say thank you. I feel like every time we've come forward, we have come with a different way to talk about the impact of this model. For some of you who have been on the board a little bit longer, you'll remember when we came with the map score slides, a few years ago, and it felt like we were having the wrong conversation. Not that talking about map is the wrong conversation, mind you, but it was just that it didn't quite capture some of the work that is really happening. And it's been a lot of hard work, as Dr. Anna Lee Good said, but it's been great work to really start to think about other ways to capture those leading indicators, to figure out ways that the work that is happening with parent liaisons and resource coordinators and amazing building principals can show up in data in new ways. So I just want to thank you for your support. It's been a pleasure.
Thank you, everyone. I echo the words of my colleagues, and I really loved the representation that the mapping captured with the color coding. So if there's any follow-up information on that, please send out our way. Really love to hear more about. I feel like this is the creativity we were talking earlier around. How do we capture really what's happening in ways that, other people have not measured? It's beyond numbers. It's telling the story that you all know, but it often doesn't get said outside of the school building. So thank you so much. Dr. Jenkins, any final words before we adjourn?
I think you guys covered it. Thank you so much. Just again to everyone who presented tonight. Thank you, though.
Yes,
I'd like to
thank you so much.
Oh, I'm sorry.
move to adjourn. Yes, at least second. All those in favor signify by saying aye.
Aye.
Motion passed. Meeting adjourned. Thank you, everyone. Have a good evening. Sleep tight. Thank you so much, Melissa, for facilitating our meeting tonight.
Good night, everyone.
Bye. Good night.